Testing mic, 1, 2, 3.
Good morning.
Good morning.
How about a camera?
I'm trying to it.
There you
There
go.
we go.
I see you. Very handsome there,
All
sir.
right. Looks everything is working.
Yes, sir.
So,
Thank you.
all right. Thank you.
Hey, Mark, can you check my audio and video, please?
Check, check, check. Drinking a soda.
It's actually a sparkling ice caffeine, just to
Oh,
be clear.
oh,
5
actually,
calories
sparkling ice with caffeine. Yeah,
with
those are the
caffeine.
best.
Yeah,
Yes, those are the
yeah.
best.
I can't do my job without caffeine. Are you serious?
I was gonna say, yeah, don't make the mistake of buying just a sparkling ice with no caffeine.
No, no, no. Although this is 70 milligrams of caffeine, so that I don't start looking like I'm on crack. So
Like
it's all good.
shaking. Start
Right,
shaking.
right. No, I can't do that much caffeine, but I do need it in the afternoon. We're doing early today though, so this might be a two caffeine day,
A 2-canner day.
2-canner day. Yep, yep.
No problem. Good morning and welcome.
It is still morning, isn't it? It does not feel that way.
I know. Seems like you've been going.
Yes, nonstop.
Keep scrolling through these names,
Okay.
hoping I see somebody I recognize. The list
Good.
grows.
It's going to today.
Okay.
Just a heads up.
Yeah. I wish I could make this on my screen. I wish I could make the list longer, but it only lets me see 2, 4, 6, 8 names at a time.
Yep, that's where we get to on our end. Question. We have several new members
Yes.
today. Hi, Saji. I saw you.
Yeah.
Everything's working.
Hello. Testing.
Yeah, sounds good. Looks
And
good.
I'll be good.
And then Saji, correct, I'm gonna run the meeting today. Is that accurate, or are you wanting to?
If you're gonna run the meeting today, I think I can help you with it, or if you
Yeah.
can help me with it, we can help each other. I think.
I will
I'll
I
do
will
that.
absolutely help you with it.
Thank
Yes.
you. Thank you.
Yeah,
I
but
read.
if you want me to do it, I can. If you want to do it all, you can. It's completely up to you.
Well, you're gonna be here, so
Yes.
I think I'll try.
Awesome. Good stuff.
All right, thank you.
When we do roll call, we'll introduce the 3 new members.
Okay.
Okay. So Rolanda is new, Jasmine's new, and Matthew is new.
Right.
They were just appointed by our last board meeting.
So Matthew, Yolanda, and
Jasmine.
Judy.
Jasmine.
Oh, Jasmine.
Jasmine. Yep.
Jasmine.
Yes.
Trying to
Jasmine.
circle.
And Jasmine is on.
Awesome.
Oh, yep. Jasmine is on. Hazel. Good morning, Hazel.
I love the plants in your background. Are those real?
Mine? No.
Not yours, Saji. No,
Oh,
Hazel.
Sorry.
No, they're as real as Saji's.
They are. Bummer. They look good though. They look good.
I think everything is just as nice as the background.
Mine's the famous
all AI.
DCA background.
It's all the AI.
Question
Yeah.
here. Here we go. Question. Should I?
Yes.
I'm gonna flip this switch. Tell me if this is how you want it to run. And go. Say
So
something.
that you're
now,
up there.
No, you're there.
I'm not there. You're there
No,
for
You're
me.
the ones in there.
You're whoever's speaking gets put on should be right next to the presentation. Is that not how it changed?
It is how it's changed, but since you're the one speaking,
Yeah,
you're popping up, and then because
Okay.
I'm kind of a pop out window on my screen, mine will not move.
Oh, gotcha.
But we will see other people pop in next to that.
Yes. Or I can put it back to the way it was. Hold on here. So that's how it was. Then I don't pop in. Obviously.
I mean, we definitely need to see the people at the top of the screen.
Yes,
We
that's
see all
still
of our
there.
attendees.
Yeah,
And so
that's still there.
when you move it, it makes it less, right?
Okay,
Or am I
right.
imagining that?
So it's just got, oh, this is, yeah. So I stopped syncing, so now we shouldn't have the active speaker anymore. So
Okay.
it should just be the people should be on top, and then the presentation should be in the middle.
Yeah, let's do that just because this committee has a lot of members.
Okay,
And so to get the majority of them on camera on the same screen, I think it's beneficial to keep it this way.
got it. Okay, no worries.
Are
I just
you
wanted
able
to
to
see.
do, you know, like on Teams, you can do like large gallery? Does
No,
WebEx have something like that?
I don't. Let's see. Let's see. No, I can only do stack, which is what we're currently
Yep,
at, or side by side.
that's it, huh?
That's it. Just
You
the two
can't
choices.
increase.
No, you can't
Can't
show
increase.
more people.
Wow.
But I want to show 1 million people.
Yes.
Oh,
Okay, yep. Yeah, it looks like we can only get what? 1, 2, 3, 4, 5, 6, 7. I don't know. I have to wait until more people
yeah.
get on.
Rez is on if you want to.
Oh, here we go. Okay, hold on. Let's see.
Hey, I see my people up in the hearing room. Hi, Macaulay. Hi, Marissa.
I did something to pop out my screen.
It's oh, there we go. Oh, Reza must he came and left. Oh, there he is again. Oops, he left. Okay, there we go.
All right, it's 11.
Hold on there, sir. Hold on. Still trying to. I don't know if people are here or not. Hold on. I'm going to promote somebody. 1 second.
Let me just.
Yes, Saji,
Chris,
we're going to have to wait to make sure that we get quorum.
Chris,
And
are
so,
you Chris Harkins? I promoted you, so it looks like you're on a phone. If you're not Chris Harkins, just let us know. Nope. Okay.
yeah, you can just go ahead.
Sorry. Let's see. Ariel. Oh, there's Ariel. Cool. Matthew. Sorry. Matthew, not present. Joanne Spitz. Nope. Okay.
So
Hazel's
we need
already
9 for
on.
quorum. Is that correct, Reza? We have 6 so far. Okay, Hubs is on to a 7.
Judy.
Judy is not going to be on today. We just got a
Okay.
message from her.
Okay. Okay, so I see Ariel, Hazel, Jasmine, Rolanda, Saji, and Wendy. So yeah, 6.
6.
6. Wait, how many we need? 9?
9.
Reza, yeah, we're a 16-member committee, so we're looking for 9 to have quorum.
So if anybody has contact information on any of your friends that might be on this committee, if you can send out a Hail Mary, that'd be fantastic. I know that Macaulay has left voicemails and has sent text messages and emails. She did have confirmation earlier this week that we would have enough to have quorum today. So maybe there's a few people that are still
Okay,
coming.
Chris Harkins is here, makes 7.
Okay, we need 2 more. Thank you guys for bearing with us as we're trying to establish quorum. We're looking for 2 more committee members to show up, and then we'll be able to start the meeting. Appreciate your patience.
Is he in there? Hold on here. Oh. Oh. Matthew Hubbs makes 8. One more. There's Alice Benjamin. We got 9.
Saji, we have quorum, so
All
you will
right.
be able to go ahead and get started. I do, before we establish quorum, I do want to do a couple announcements. We do have 3 new advisory committee members. So Saji, when you do roll, if you will, right after we do roll, just give them a chance to introduce themselves. And before we move on, and then after we establish quorum, I do want to make one announcement.
All right.
Thank you.
All right. So the Nursing Education and Workforce Advisory Committee will now come to order. First in the agenda, I will do a roll call for the quorum today. I'll start with myself, I think. I'm here. Tommy Bond Hall, Dr. Tommy Bond Hall,
She is not in attendance
not
today.
here. Sherry Fortin,
I am not seeing her yet either. Oh, she is in the attendees. Can you elevate her, board moderator, please? Sherry, are you able to come off mute and be counted towards quorum, please?
Yes, I'm sorry. Just trying to get organized here with my technology. Yes, I'm here.
All
Getting my
right.
camera.
Thank you.
Welcome. Next is Wendy Hansbrough.
Hi, everyone. I'm
Hello.
here.
Good morning. Next, I have Alice Benjamin.
Present.
Hello. Dr. Hazel Torres.
Morning, present.
I have Christopher Harkins.
Good morning, I'm present.
Hello, good morning. And we have Jacqueline Bowman. Nope. We have Ariel Hernandez.
Morning, present.
Hello. And next is Chris Perry. Nope. And we have Dr. Joan Spatz.
She will not be in attendance today.
All right. And Dr. Matthew Hobbs.
Good morning, present.
Good morning. All right. And as our executive officer, Ms. Melby, have announcement, and I think we have 3 new committee members that will have to be introduced today. So we may
Yes.
want to start with Jasmine.
Yeah, Jasmine, if you want to come on and just give us a quick introduction.
Hi, my name is Jasmine. Should I say anything about myself or just say hi?
You could say whatever you want to about yourself. Yes.
I am an active nurse at Ronald Reagan UCLA, and my primary specialty has always been ICU, but the past couple of years it's been in peri-op. And thank you for having me.
Thank you. Welcome.
Thank you. And we have Rolanda Jackson.
Good afternoon, everyone. Rather, good morning. My name is Rolanda Jackson. I've been in nursing for 26 years now. Current behavioral health executive and currently supporting a magnet hospital in the California Bay Area.
Welcome, welcome. And the
Thank you.
last but not the least, we have Mr. Dr. Matthew Hobbs.
Thanks, Saji.
Hey.
I'm pleasure to be with you here all today as the public member of the committee. I'm a senior vice president for strategic initiatives for Westcliff University, as well as our accreditation liaison officer with WASC.
Nice and welcome. Thank you. And I think the next to the agenda, the executive officer Melby will be having her announcements.
Yes, thank you. I appreciate that. We do have another member that will be hopefully appointed at the next board meeting, so we'll be able to have a full NEWAC committee. There is two announcements, sorry, that I want to make sure that I get out in front of here today. The very first one is agenda item 10.0. It was information discussion overview on the 2026 regional forecast of the registered nursing workforce in California report that was supposed to be presented by Joanne Spetz. She is not able to be in attendance today, so we will not be holding agenda item 10. Additionally, we have been contacted by media letting us know that there is a potential understanding that Nightingale College from Utah was going to be on the agenda for discussion today. I wanted to let people know that that is not correct. However, we do see that we have several attendees, more than we usually have in our NEWAC committee, 178 right now with 2 people in person. We are not going to bar you guys from having any conversation. I just want to let you guys know that you're not waiting around for an agenda item. We will be opening up for public comment for items that are not on the agenda. We request that you guys use that time to make any public comment that you wish for us to hear. That will be typically, I don't see it on the agenda, item 3.0, I believe. Because we will do a agenda item 2.0, which will be general instructions, and then 3.0 is typically public comment for items that are not on the agenda. So you will not have to wait for an agenda item later in. We will hear all of your guys' comments at 3.0, public comments for items on the agenda. So thank you guys for that. Thank you guys for being here, and we look forward to hearing from you when we get to agenda item 3.0, public comments for items not on the agenda. Thank you.
And Lori and Saji, if I may briefly, this is Reza, the board's legal counsel, regarding public comment. If it is indeed true that we're anticipating comment from folks regarding Nightingale College, I guess that's to be determined. We'll find out here, but just wanted to clarify what Loretta was saying, that there are statutory restrictions that this committee can only discuss what's on the agenda for today's meeting. And so Nightingale College was not agendized for discussion today. And I'm not sure that it typically would be something that would be brought forth in front of this committee. The board has another committee as well as the board itself, which might be typically kind of more the logical place for a discussion of what's going on with Nightingale College. But anyways, it is a statutory restriction that prevents this committee. It's not just the fact that the committee doesn't want to get into it or doesn't feel like it. They're prohibited from doing that by law. So we are, as Lori said, able to take public comment regarding anything, including anything that's not listed on today's agenda. But the committee itself is precluded from going, engaging in discussion about anything that's not on today's agenda. So that was one point. Secondly, just wanted to put forward, I guess when we turn to public comment for items not on the agenda, we'll see how many folks line up for public comment. And at that time, depending on how many folks are actually lined up, the committee may want to consider whether or not to impose a time limit for each public comment. Because if we've got 180 right now, 184 attendees on the WebEx, and many of them want to make a comment, that time could quickly add up. So something to maybe just consider when we get to that point of having an idea of how many folks are actually lined up there.
All right.
So with that, I'll turn it back to you. Thank you.
Oh, thank you. Thank you. So I just want to make a statement because I am not the chair of the committee, of course. I am the vice chair because the chair of this committee was actually, I'll say she completed her tenure for this committee. So I'll be standing for her behalf. I mean, she's not here anymore. So it's going to be me chairing this committee, NUWAC committee today. Thank you. And then for I think just to confirm that we have a quorum for today after the roll call.
Yes, we do.
We do. All right. Thank you so much. And we'll go ahead with our next agenda item. I think that we'll have to move to 2.0, the general instructions for the format and teleconferences of this meeting. Thank you.
Good morning. This is the BRN moderator. I will be moderating the meeting. To facilitate public comment, we will be utilizing the WebEx question and answer feature, now known as Slido. When the committee reaches a point in the agenda at which public comment is appropriate, the question and answer feature will be turned on and members of the public can indicate that they would like to make a comment by inserting the phrase, "I would like to make a comment," in the question box, which is typically in the lower right of your screen. I will then call on the individual and send the request to unmute their microphone. The individual should be able to unmute and make their comments. I will then proceed to the next member of the public who has a comment. I will also query our on-site location for comments as well. Please note that the question and answer feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. When your turn comes, you will be prompted to unmute. If your question can be answered, the committee will respond accordingly. When making your comment, speak about anything you believe is important for the members to know. Remember, committee members cannot address any item not on the agenda, items not on the agenda at that moment, items that you would like to add to a future meeting, or items that will be discussed later on the agenda will be discussed at their correct times during the meeting. I will provide a brief reminder of this approach at the start of each public comment item. Finally, when the committee members or BRN staff are not speaking, I would like to remind them to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will mute your microphone automatically. And that is my general instructions. If we can confirm a time limit for our public comments. Please.
If we continue to have, we have greater than 205 people on the WebEx right now. So if they are all here for public comment, we will be limiting it to 2 minutes. We will have to open up public comment first and see what the first commenter is to be able to make that decision.
All right. So we will move forward. Thank you, Reza, for this announcement and instructions. And let's move forward for the agenda item number 3.0. This is opening the public comment for items not on the agenda. And maybe that we may put it or these items in future agendas.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." I'll pause for a moment for members of the public to type in, "I would like to make a comment." Please remember, you will have 2 minutes. Thank you.
And I'm just suggesting here, give a little bit longer than usual to see how many folks start to line up, and then we'll go from there.
No problem. Right now, there's only 2, so we should
All
be
right, thank you.
good.
With that announcement, can we also add if people wants to go to the bathroom or take a rest break later on, when do we do that, and who should we alert?
If at any point, we would just schedule that in. We are only scheduled to be here till I believe 2 o'clock.
2 o'clock, yes.
2 o'clock. So Saji, with you being the chair, if you need to at any point pause to use the restroom, you definitely can.
All right.
We would just ask for a 5 to 15 minute
Recess.
break at that point. Yep.
All right, thank you.
Yep. Thank you.
Samantha Gerard would like to make a comment. 1 second, please.
Wait, hold on. Sorry, before we get into it, how many comments are we looking at?
Right now, there's
Currently, we
4.
have 4.
Oh.
We have 4 so far in the chat. I don't know how that's going to go. 2 of them are related to Nightingale College. So we'll see how that goes. Samantha Gerard is a director of nursing of a school. So she came on first, so we'll let her speak first, of a California-based school.
Very good. Thank you. That's all.
Thank you. Thank you so much. My name is Samantha Gerard. I'm the Senior Director of Nursing and Health Occupations Programs at Southwestern College in Region 10, San Diego Imperial County. My statement today is, I represent 8 separate nursing and health occupations programs. That's anywhere from 300 to 400 students annually in our region. My statement has to do with pre-licensure nursing programs. So Southwestern College respectfully opposes the approval of additional pre-licensure nursing programs in Region 10 at this time due to documented and ongoing clinical placement saturation that is already displacing students in existing approved programs. Region 10 nursing programs are operating in an environment of severe clinical constraints where the number of pre-licensure programs exceeds the region's available clinical training capacity. Hospitals and community partners consistently cite staffing shortages, limited preceptor availability, patient acuity levels, and scheduling constraints as reasons for denying or canceling placements. And keep in mind, these are historical placements that we get semester after semester. For over 20 years, these placements are being canceled. Now, these constraints have resulted in actual student displacement and course disruption, not merely a projected risk. At Southwestern College, this impact is clearly documented. In the spring of 2024, the college was displaced from 18 obstetric clinical placements, or 18 students, directly affecting student progression and cohort scheduling. More recently, in the fall of 2025, 18 psychiatric and mental health clinical placements, 18 students, were canceled, outright canceled, with no reason given, further demonstrating that displacement is not isolated or historical, but ongoing and unresolved. This fall, 2026, I also had 18 psychiatric and mental health clinical placements given to another school that had never had that placement before and is newer in the area. These losses occurred despite longstanding partnerships and reflect the fragile and overextended nature of the region's clinical placement ecosystem. Local healthcare facilities have also responded to staffing and operational pressures by reducing the allowable clinical group sizes. Several Region 10 partners have decreased group size from 8 down to 6, significantly reducing the number of students that can be accommodated for rotation and further constraining clinical capacity across the region. During a recent Nursing Advisory Board meeting attended by many of the chief nursing officers from Region 10, major healthcare organizations, employers, they reported that they are not experiencing a shortage of new graduate registered nurses. Now, this is anecdotal coming from them. but they say that hospitals emphasize a critical workforce shortage among experienced RNs in specialty areas. This feedback highlights a misalignment between pre-licensure program expansion and actual workforce needs. Approval of new pre-licensure nursing programs in Region 10 would further intensify competition for an already insufficient number of clinical placements. New program approval would require access to the same acute care, OB, psychiatric clinical sites, and pediatrics currently relied upon by existing community colleges and university programs in Region 10. Given current saturation and reduced group sizes, this would likely result in displacement of students from established programs, increase our cancellations, having to reduce our cohort sizes, and further erosion of long-standing clinical partnerships. While workforce data continue to show overall demand for registered nurses, the primary constraint in Region 10 is not a lack of graduates or instructional capacity, but insufficient clinical placement availability. Community college nursing programs are disproportionately impacted by the saturation as public institutions. They serve a critical pipeline for locally trained nurses who reflect the communities we serve. Clinical displacement undermines equity, delays student completion, and diminishes the return on public investment in nursing education. Given the documented displacement in Region 10, reductions in clinical group sizes, employer confirmation that shortages are concentrated among experienced specialty RNs, not new graduates, and the anticipated impact of adding new programs, which I will not name, approval of additional pre-licensure nursing programs at this time would be counterproductive. For these reasons, we strongly urge a pause in approving additional pre-licensure nursing programs in Region 10 until clinical placement capacity demonstrably exceeds or at least meets the current program demand and existing displacement has been resolved. Thank you.
Thank you, Samantha. I do want to let you know that the upcoming board committee meeting that has education licensing on is August 11th, and we will be posting that agenda at least 10 days prior to that. I hope to see you present for public comment at that one as well as our board meeting September 24th and 25th to share this information.
Thank you.
Thank you. So real quick, Reza, just so you're aware, in the comment section, there are 8 comments. However, one of them has 24 thumbs up. One of them has 17 thumbs up. Another one has 10. Another one has 7, 4, 2. Those are secondary comments. People may wish to chime in on those. We wouldn't know that they would want to chime in. They would have to make a separate, I would like to make a comment. Just thumbs upping them, saying you agree with that ask doesn't necessarily allow us to find you in the attendees and unmute you for comment. But I do see that there are quite a few people asking for comment and agreeing for comment. And so it looks like the Alex D or Agro would be the next one to open up board moderator.
Right. Yes, I'm gonna ask the question here. If they're making a statement in here and not technically asking for a comment, would you like me to ask them if they want to make a comment, or
yes, please?
do I just want? Okay, no problem.
Yep.
Alex D would like to make a comment. 1 second, please.
Sorry, are we going to? We're limiting to 2 minutes per comment, just to remind everyone. Is that right?
Correct. Yes.
Oh.
Okay. Sorry, let me get that ready.
Yeah, and then you, board moderator, you could say how that will go if once we limit it to 2 minutes. If you have your spiel.
Gotcha.
Do we have a timer that's gonna run?
I do.
Okay.
Yes.
Board moderator does. Yes.
All right. Thank you.
Mhm.
But before we proceed, Lori, this is Reza. So it's just occurring to me that even some of our other committee members might not have kind of a backdrop of what's taking place with
Yes.
Nightingale. And, obviously the comments to come, assuming that they're generally all going to be related to Nightingale, will be informative. But I had kind of considered making a brief comment or two myself, either before we kind of dive into the Nightingale comments or after. Do you happen to have a preference?
I think
Whether I jump in
making
now or-
a comment in advance would be helpful, especially for the
to kind of give a
students
little bit of
and recent
context.
graduates that are
Yeah,
in public comment, as well as our committee members, just letting them know kind of what's going on and why
sure,
they're here.
Thank
sure.
you. That should help us also to
Yeah.
contextualize
And
what's going on.
Just some background before
Correct.
Reza starts. Nightingale College is a out-of-state nursing program located in Utah. And so we'll have Reza move from there.
Sure. And there's a few things I just kind of thought to mention, and maybe after we hear some of the comments, we'll see if there's more to address. First of all, again, as Lori said, Nightingale College is an out-of-state nursing school. I believe they do most of their teaching online with some in-person clinicals and things. As a quick aside, tangential to the main point, to avoid any confusion, we have had some confusion just due to the use of the school's name is Nightingale College. Meanwhile, there's a completely separate, unrelated thing called Operation Nightingale, which is a federal investigation into some fraudulent nursing school operations and diploma mills. Those are not to be confused. As most of you know, the term Nightingale is frequent. It's prevalent in the field of nursing. Nightingale College is not, as far as we're aware, implicated in any way in Operation Nightingale. And on our website, we have information about Operation Nightingale. So some folks have gone on the website looking for information about Nightingale College, only to find our page about Operation Nightingale, and may have gotten some confusion over that. So those are not related in any way. The issue that's going on with Nightingale College is that under the board's statutes, as you know, the board approves in-state California nursing schools. They're under our jurisdiction. We have nursing education consultants that work with those schools, and it's kind of all a pretty formalized process of board approval and the changes that they need to make that need to go through the board, etc. When it comes to out-of-state nursing schools, our statute says that the board can approve an applicant who graduated from an out-of-state school, and I'm paraphrasing, but this is essentially what the statute says. We can approve an applicant who graduated from an out-of-state school if that school's course of instruction is equivalent to the board's standards for schools in this state that the board does approve. So the standards is essentially equivalency between our course of instruction, our requirements, and other schools. So Nightingale College the board is looking at Nightingale's course of instruction to review whether that coursework meets the board's minimum standards. And that's been a little bit of a process, and it's still ongoing, as at this time the board is not able to conclude definitively that Nightingale College's curriculum meets our standards. And there's a couple hangups, and wasn't planning on going too deep into what those current hangups are, but we are working actively with the school to try to resolve those, or if nothing else, identify what the deficiencies are as far as the board is concerned, and get everybody answers. So the board, the situation for the applicants who have submitted their requests for authorizations to test, and they are, quite frankly, somewhat on hold. They're in, we'll acknowledge, somewhat of a limbo status, and that is not lost on the board. We recognize that those folks are eager to test, that time is of the essence, and that they want to get out there and pass the test and get to work doing what they've trained to do. The board is unfortunately kind of caught in the middle right now, where we have to, we recognize that, while at the same time we have to uphold what our statute says and enforce it, and ensure that the coursework that those students have taken meets the board's minimum standards. One other kind of tangential piece I just wanted to mention for the folks that are listening. This committee, the Nursing Education Workforce and Advisory Committee, I welcome everybody who's lined up to make comments. All stakeholder engagement and feedback is good. But this committee is probably not the one where we would normally take up issues relating to a specific school. I won't say that it's completely, out of the realm of possibility or totally, outside the norm, but normally this committee deals with policy issues, whereas the specific issues going on with Nightingale College, apart from like any higher level policy related issues, would probably be more likely actually taken on in the board's education and licensing committee and in front of the full board itself. So, and then lastly, unless Saji or Lori want me to say anything else, or if anything else is prompted by the comments.
Thank you. I was going to ask if this is something that we need to agendize. I don't think that this is on the realm of our committee, though.
Yeah, I'm not thinking, Saji, that this would be something that would go on the Nursing Education Workforce Advisory Committee.
Thank you.
This is a licensing issue. It is a process that we utilize through every out-of-state nursing program. And this review is just taking longer than would typically take. And so we are working with the school. It is, we just received more information again as much as last week. So we are actively in that review process and communicating back and forth. And as soon as that review is complete, we'll be able to let people know what exactly is needed to move forward for licensure. One of the things I will add that we're very well aware of statistics here with the Nursing Education Workforce Advisory Committee, and how important it is to take the NCLEX within 3 months of graduation, because that is when you are the most successful in passing. In order to take that NCLEX within 3 months, you have to apply to any board of nursing throughout the nation and request an authorization to test. That authorization to test is sent to Pearson VUE, who administers the NCLEX. And Pearson VUE, you're able to sit in test at any one of their locations. And then you would become licensed if you pass and meet the licensing criteria of the state that you request that authorization to test with. These students did graduate from Nightingale College in Utah. They are more than welcome to request an authorization to test from Utah in the meantime, so that they can sit for their NCLEX and pass and be ready to be licensed. They would be licensed in Utah at that point. And then they could endorse into any other state, apply for endorsement into any other state in the nation, that they would then review whether or not they meet their individual licensing criteria and potentially allow them to be licensed in that state as well. I believe Utah is also a compact state, and so they would be able to apply in Utah for a multi-state license as well, instead of a single state license, which would allow them, excuse me, greater flexibility. That is what I'm hearing that some applicants are doing right now because of the delay with the California review process. We do not want you guys to lose your knowledge and lose your ability to pass NCLEX. So if that is something that you guys are becoming increasingly concerned with, you do have the ability to apply for your authorization to test in Utah, so that you can at least have your NCLEX taken and have that pass registered, and you're not losing any of that academic knowledge as time progressively increases from when you completed. So I do want to make sure that you guys do know there is a path to your NCLEX outside of California while we review. for equivalency. And so at that point, board moderator, if you would like to open it up to start the public comment process, we will do our best to hear and limit it on the responses that we can make because it's not agendaized.
Thank you. Thank you for those
Thank you.
clarifications. We can move forward and continue with the public comments.
Okay, so since all of our public comment requests were liked, the list has changed, so I don't even know who was first anymore.
The
I'm
one
just
that's
gonna
the oldest is 19 minutes, and that would be A Grow. So I would go by the minutes.
19. Oh, okay, I see
Yep,
what
you
you're
see
talking.
that on the thing. There's a couple that are 19 minutes.
I don't
And
have
then we
I
just,
don't have minutes. I just have times.
oh, okay. I have A Grow is 20 minutes to grow. So I think
Okay.
A Grow would be the first one to go.
Hi, sorry, I'm Alex D. I've been unmuted
Oh,
this
I'm
whole
sorry.
time
Alex D
for
was.
Oh,
comment.
thank you.
He's been
Sorry.
up. Yes, I'm sorry. Alex D was
Go
up
for it.
first.
No, you're quite all right. All right. So thank you so much again for your time. My name is Alex. I'm one of the many California residents who are being affected by the BRN's review of Nightingale College graduates. Unfortunately, we have not been given a time frame for completing this review, and as you have mentioned, it is affecting students and graduates who still don't know what the specific issue is that remains to be, resolved. So I am respectfully requesting that the board place Nightingale matters on a future public agenda. I am interested to understand or to have transparency about what is this unresolved curriculum, clinical or documentation issues. If we would be able to receive any kind of aggregate information that shows how many Nightingale applicants have received their ATTs or how many are still on hold, as well as if we could be given a public timeline or any kind of regular progress update that shows what's going on with the review until it's completed. I just want to make it very clear that I'm not asking the board to waive any kind of California requirements. I definitely respect the work that you guys are doing to make sure that you have effective nurses in the workforce. Just for that transparency and to help find a defined path forward. There are a lot of people who unfortunately their loans are going to start to come back up and they can test out in other states, but if they can't work here as a resident of California, then that is also going to be putting them into some financial hardship.
Thank you for that. We do not have a specific timeline. Unfortunately, it is dependent on the information received from the school and the review process. Like I shared earlier, the most recent information that was received from Nightingale College for review was sent to us as soon as last week. So I can tell you affirmatively that it is the top priority. It is the school that is being reviewed. No other schools being reviewed at this point. It is Nightingale that is being reviewed. All other school review processes have been put on hold while this review is completed because this is the one that is the largest effect at this point.
All right, thank you. I think we can move to the next public commenter.
A Grow would like to make a comment. 1 second, please.
Grow is recognized. Thank you.
Thank you for your time. I would like to second Alex D's motion to agendize the Nightingale College issues for the next public comment, understanding that the specific issues should be more pertain to the BRN's Education Licensing Commission or committee, which we'd like to have some instruction on how to get this subject agendized for that committee as well, please. It is to our understanding that Nightingale has sent over their accreditation and their course curriculum. So again, I believe Alex D has pretty much stated what we are all here looking for regarding the issues for being able to sit for the ATTs for the NCLEX for California residents. That was all. Thank you.
Appreciate that. Thank you. This committee cannot vote to have it added to another committee's agenda. So they will not be able to take that vote, but I will work with legal counsel to see what is appropriate for potentially doing an agenda for education licensing or the board. But I can tell you education licensing is next month and the board is the following month. And we're hoping to have the review and the information out prior to that. So we're hoping to not have to agendaize it if at all possible. And we're hoping to have communication go out through your school soon. I know that your school did send messaging out, I believe, last week as well. And so hopefully this will be solved soon.
Thank you kindly, Committee Member Membley.
Thank you. And I think we can move on to the next public comment.
Thank you. Steve Brainy would like to make a comment. 1 second, please.
Hello, thank you, board, for your time. I also just want to second what Alex D said, and I appreciate all that you're doing. Thank you.
Thank you.
Thank you for your comment. Nightingale student would like to make a comment. 1 second, please.
Nightingale students recognized.
Nightingale student, are you able to unmute yourself? If you have windows open on your computer, you would have to minimize them. Oh, Nightingale student, hold on here, let's see. They dropped off. Okay. BB Jazz would like to make a comment. 1 second, please.
All right, thank you. Jazz is recognized. Please make your comment.
Good morning. Can you hear me?
Yes, now we can hear you. Thank you.
Perfect. Thank you so much. Okay. This is BBI Jazz. I am a California resident currently enrolled in an online out-of-state BSN program. I appreciate, thank you, Chair and the board members for the opportunity for allowing us to speak. I appreciate the work the board does to protect the public and ensure nursing graduates are prepared to provide safe patient care. I would like to respectfully ask for clarification on how the California BRN evaluates clinical education for online nursing programs. Specifically, how does the board determine whether an online BSN program has meets California's clinical requirements, including the 500 direct patient care hours and the required specialty areas, For programs that use combination of virtual clinical based care, which currently my program is using Nightingale, which is called VCBC. It is an hour session once a week with our professor, and we discuss about the virtual patient, which is the VR patients. And we are currently using virtual reality VR. In general, stimulation and in-person clinical placements. Most of our clinical hours are spread using these methods. Which of these, in these experiences, does any of these count towards the direct patient care requirements? How are these different clinical learning methods evaluated when determining whether graduates are eligible for California license? In addition, many of us have been told that Nightingale College has submitted information requested by California BRN and has been cooperating through this process. We have also heard the college state that some of the information requested by BRN is outside of its legal rights. As affected California student, we would respectfully appreciate hearing directly from California BRN whether this information being told to us by our school is actually accurate or not. We were told that there were legal counsels involved as well. What information or documentation remains outstanding? Hearing directly from California BRN Board would help provide clarity and allow students to make informed decisions about their future and their education. Finally, I respectfully request the board to consider placing Nightingale College on a future meeting agenda so affected students and graduates can receive updates directly from California BRN, because at the moment, students deserve transparency from both sides. I know that you guys cannot discuss Nightingale today, but I would truly appreciate if you can clarify the direct patient care hours, because this is an online school and we're all attending this program. And if the clinical hours are not meeting California standards, then this really does impact our education. And I'm in my second semester, and I would truly appreciate some guidance so I can make an informed decision if I have to transfer or move elsewhere. Thank you so much.
Appreciate that. I'm going to give you some website information for everybody that is in the comment periods to take a look at. On our website, and I'm actually going to screen share just so that you guys can see what I'm seeing. So give me 1 second here to pull this up. Okay, this is our California Board of Registered Nursing website. On the front page, it says Nursing Practice Act. You can click on that. You can go down to the pre-licensure nursing programs, Article 3. And then it's going to load, and we're going to go into 1426, which is required curriculum. This is what we are looking at when we review any out-of-state nursing program to ensure that they meet our licensing requirements. This is the exact requirements that our in-state programs are held to, as well as international out-of-country graduates. Everybody is held to the exact same requirements. It does talk about the requirement for 58 semester units, 87 quarter units. 18 of those semester units must be in the art and science of nursing in theory, and then 18 semester units must be in the art and science of nursing that are clinically based. Additionally, they do need to touch all content areas: med-surg, OB, peds, psych, mental health, and GERI. They also need to cover all of the content that is in D, where it says instruction outcomes will focus on. And then it also says the following shall be integrated within. And this on the very bottom G is a calculation that is used to make sure that the hour requirement is the same. The other additional one that is in there is D, where it says theory and clinical practice shall be concurrent in the following areas. So I'm going to back up again to another document that we have on our website that I will share. And that is, if you go to our homepage under education, it'll say pre-licensure distant education, institutional and programmatic information. This here talks about how clinicals can only be utilized in California if they are a California approved in-state nursing program currently. And so if you're an out-of-state nursing program, they cannot do clinicals in our state. And then this is a kind of easier at a glance kind of breakdown of what is required in order to obtain licensure here in California. Another helpful item for applicants to look at, again, going back to the Nurse Practice Act, going back to pre-licensed nursing program, is in our definitions, 1420. In our definitions, it does talk about planned learning experiences designed for students to apply nursing knowledge and skills to meet course objectives in a variety of board-approved clinical settings. Clinical practice includes learning experiences provided in various healthcare agencies, as well as nursing skills labs, simulation labs, and computer labs. So with that said, I will stop sharing and let you guys know that we do have a law in place that says you have to have 500 direct patient care hours. What that means is 400 plus of your hours can be in simulation. They can be virtual. They can be in a laboratory setting. They do not need to be in person. That comes to about 44% that does not have to be in direct patient care if you align with our calculations. However, 500 is required to be in person taking care, not in person, sorry, let me clarify that, direct patient care. That can be in person. We have also had the allowance of telehealth because you are providing direct care to a patient. It must be a validated telehealth experience and not a simulated telehealth experience. There needs to be a patient chart. There needs to be a physician. Or a advanced practice provider that there needs to be able to be billed for insurance unless there is a self-pay process aligned. But it cannot be a simulated telehealth experience. Simulation only counts for about 44 to 45% of our hours here. The remaining 500 in our law is required to be direct patient care. We are looking at all of the clinical experiences that are offered in Nightingale and looking at which ones meet direct patient care hours, which ones do not. You do have hours that do meet our requirements. We haven't got the total of that because, again, we just received additional information last week. The people that are in the conversations with your school is myself and Reza Pejuhas, legal counsel, both of us here on this call. They are being cooperative. They are providing us information. They are, as far as we know, and just the information that was shared with you guys today, it is accurate what they are saying. We might have a little disagreement on what we're legally allowed to have, but that is something that we'll be working out with your school and not something to be really kind of discussed here. But we are taking this as a very top priority review. Yes, it has been a while that it's been in review. It took a while to get information sharing abilities to move at a good speed. So they are now, and we are completing the review process and hope to have something soon. And I can't give you a timeline because it just depends on what that review shows.
This is
All right.
Reza, I'm sorry. That was a lot of helpful information. I've been also making notes, and I think it may help to hear out the rest of the comments and then kind of give a sum up statement. I see this as, as I said, the committee itself can't go into a whole lot of discussion, but I do see this as a valuable opportunity. As Lori said, she and I have been in these discussions, and it's an opportunity for us to address the folks who are so eagerly waiting for information on this. So we've got you all here. So we may not be able to answer every single question, but I do want to answer what we can and at least give some let you walk away with some greater understanding of what's going on, if not a little peace of mind. I'll go a little bit more into the direct care piece of it, I guess, right now, because that's, I think, just kind of fundamental in all this. We've received information from Nightingale. It's correct that they've provided, and they've been cooperative. They've at least provided the information that they think the board is entitled to request and needs in order to make its determination. There's been some I'll say back and forth, and some not seeing totally eye to eye on exactly what the board might need to complete its review. But I'll say up front, the board, this is an out-of-state school that's not directly under the board's jurisdiction. We evaluate the applicants who apply to the board for licensure, and those applicants completed their education at Nightingale. So we're not evaluating Nightingale, we're evaluating Nightingale's course of instruction to see whether those graduates who have that Nightingale degree have completed coursework that's equivalent to the board standards. So because of that fact, the school pushed back a bit on what they wanted to disclose to the board. And I will say that that's an issue that hasn't really come up frequently in these reviews with other schools. But that's not the main issue. I would say one of the fundamental issues is a legal disagreement that the school has taken a position questioning whether their graduates and their applicants to the California board are indeed even subject to the 500-hour direct patient care clinical requirement. Historically, the board has always, always take that with a grain of salt, but for years, decades, the board has had this historical requirement of completing a minimum number of hours in direct patient care clinical training for in-state schools as well as out-of-state schools. Nightingale is at this point questioning whether their graduates are subject to that. If that were true, then what we would have is a situation where graduates from California in-state approved schools would be required to complete 500 hours of direct patient care as per our requirements. And Nightingale is taking the position at this time, or at least they're questioning whether graduates of out-of-state schools must meet that same standard, or whether there's a different standard applicable to them. So that's currently at issue. This board firmly takes the position that equivalency is the standard, as is clearly articulated in the statute, and that the equivalency means it's clear. There's no question. 500 hours direct patient care. So the very applicability of that requirement is a little bit up in the air, and whether or not the school's students are doing 500 hours of direct patient care. Obviously, I think it's fair to say that like a VR patient is not going to constitute direct patient care. So it's, that's a cool modality. It's, I'm sure, helpful for training, but it's not direct patient care. So it's still a process. I regret to say that it is a process going through this stuff and getting the information from the school and for the board, for Loretta herself to evaluate it and make these determinations. And ultimately, as far as a time frame, again, I regret to say that we wish we could give a precise time frame, and if we could, we would hope that it would be sooner rather than later. But because of just the nature of what I just told you, and where the different avenues that this could go, it's hard to say right now what the time frame is. But that's why I started this by saying, before we got into any of this, that the situation that our pending applicants who are affected by this is absolutely not lost on us, and we are highly sensitive to that and treating this as a high priority. So I wanted to kind of just be direct, at least on some of what's going on. There was a call for information about what the underlying issue is. So I'm sorry that we can't go, too in depth. I'm recognizing again here we've been an hour in this meeting and really haven't dove into the agenda items itself. But I'll pause there and maybe we can continue with the public comments, and I'll keep taking notes. And if there's a need for me to kind of jump in at the end again and sum anything up, I will, but I'll leave it there for now.
All right, so I think we can move forward to the next public commenter. BRN moderator, is there anybody else that's pending?
Oh, yes, we have many.
Yes.
Just as a reminder, try and keep your comments to 2 minutes if you can. Orlando would like to make a comment. 1 second, please.
Orlando is recognized, and you can make your comment.
Hi, can you hear me?
Yes, sir.
All right, thank you so much for your time. We really appreciate all the information you have provided us. So I'll just give it a little bit information about myself at least. So I am a California LVN who has been an LVN in California for 12 years, and I have 12 years of experience in the state. I received my LVN license here. And like many of us working nurses, I chose Nightingale because traditional RN programs in California often require full-time in-person attendance, which in reality isn't realistic when you have to work to support yourself and your family. And for many of us, leaving our jobs or moving out of state to attend another program or to get licensed elsewhere just isn't possible because of our financial and family responsibilities. Flexible, accredited programs like Nightingale provide a pathway for experienced LVNs like myself to advance our education without leaving the workforce or the patients we take care of. With the current California BRN ATT delays, also given that I have 2 semesters left with the school and my degree and license, what is the most effective and professional way for students like us to advocate for ourselves and to help decision makers understand why these educational pathways are so important for us?
For the comment, take note. That's noted. Let's move to the next commenter.
Rachel Baxter would like to make a comment. 1 second, please.
Before we go into that, I just wanted to add, just as we continue through these comments, I just want to kind of set an expectation that we may not be answering each question as they come. And we may not be able to answer all the questions that come out through this, but we do appreciate them. We're taking notes, and as I said, we'll try to circle back at the end to what we are able to speak to.
Thank you, Reza. Moderator, do we have next commenter?
Yep. Rachel Baxter.
Rachel Baxter, you're recognized, please.
Hi, can you hear me?
Yes.
Okay, fantastic. So I'll try to make this quick. So if the board ultimately determines that deficiencies exist within Nightingale College's curriculum, what is the board's plan for graduates who have already completed all program requirements in good faith? Specifically, what pathway will be provided to allow qualified graduates to become eligible for licensure without being unfairly penalized for circumstances outside of their control? Also, the board has emphasized the importance of direct patient care experiences in nursing education. At the same time, many out-of-state nursing programs face significant challenges obtaining in-person clinical placements in California. How does the board reconcile these expectations with the barriers to accessing California clinical sites? Does the board believe these limitations may unintentionally hinder the preparation of future nurses and contribute to California's nursing workforce shortage? If so, are there plans to improve access to in-state clinical opportunities while maintaining educational quality? Lastly, if California graduates are ultimately required to seek initial licensure in another state, such as Utah, before returning to California, what guidance can the board provide regarding that process? Would the California BRN accept licensure by endorsement for graduates in this situation if they meet all applicable requirements? Approximately how quickly could a graduate test in another state, obtain licensure, and apply for endorsement into California? Additionally, for many of us, including myself as a single mother of 3, relocating out of state is simply not a realistic option. Has the board considered the financial and personal burden this process could place on graduates? And is there any alternative pathway that would allow us to become licensed in California without leaving the state? That is all.
Thank you. So I will jump in at this one real quick and just kind of level set if I can. We are not telling you to go and do an authorization to test in another state. And we are not telling you that your pathway to licensure is through endorsement. We are saying that if you are worried about the length that it's taken for our review in order to get an authorization to test, you have the option to apply for an authorization to test in Utah, where your school is located. That may not be the right choice or financially something that you guys can do. So we're not telling you to do that. I made that statement as a, if you are concerned with the delay towards taking your NCLEX because you have not been issued the authorization to test through California yet. Endorsing applicants are held to the same standard as exam applicants. Your curriculum needs to meet licensing standards in California, whether you've been a nurse for 20 years or you are just a new graduate nurse. The same standards hold true. So if it is determined that a out-of-state school, and I'm not saying Nightingale, I'm saying in general, if it is determined that a out-of-state school does not meet licensing requirements, I apologize, I had some background noise. If it is determined that an out-of-state school does not meet curricular or coursework requirements, our licensing team offers what is called deficiencies. If it is determined that they are deficient in med-surg, they can go and take an additional med-surg course. If it's determined that they're deficient in obstetrics or pediatrics, they can go take an additional obstetrics or pediatric course to obtain licensure. This is our current process that is happening today with many of our international graduates, including those in Canada, as well as some out-of-state nursing programs. When we determine that they do not meet that requirement, we let that school, that academic institution know as well, that they don't meet the requirements. I've had personal phone calls with Arizona State University, letting them know that they did not meet our licensing requirements. That school then told any California applicant that if you wanted to be eligible for licensure in California, you needed to take microbiology with lab because that was not one of their coursework requirements. The onus of whether or not a school prepares their students for licensure falls on that school. That school, when they take a student in as an applicant into their program, and that program requires that student, prepares that student for a professional license in any state, they are required under the federal law to say whether or not they meet that state's requirements for licensure. It is not the individual board of nursing in all 50 states and 4 United States territories to make that determination for the greater than 5,000 nursing schools in the nation. Therefore, when we communicate that information, if there are deficiencies, the applicant here in California, the graduate applicant or the licensed RN from an international or out-of-state standing will be made aware of what the deficiencies are, and then they will be able to decide a path forward. There are schools throughout the nation as well in California that offer one-offs. If they're deficient in OB, you're able to apply to a school and say, do you have clinical placements for me and theory placements so I can do OB? And they will do an OB theory and clinical because, again, our requirement is it's concurrent. What that means is that your OB clinical must be done in the same semester that your OB content is given. And so that is a path forward. Additionally, like the Arizona example that I gave, is if that school is now aware that there is a deficiency and they do not meet the criteria, that school can make a plan with their graduates or their current enrollments or prospective students to update their curriculum and allow for a process that they can deliver that curriculum so that you can then meet that requirement. An example would be if it is determined that an out-of-state or an international-based student school is short 2 units, and it is determined that those 2 units are located that would have held leadership, management, and advanced med-surg criteria, then that school could offer an advanced med-surg course with clinical that would be able to be given concurrently. that would then be able to allow them to sit for licensure in the state that that deficiency is determined in. It would be up to the school if they decide to do that. And it would be up to the applicant for licensure in California to determine whether or not that is a path that they want to pursue. So we don't know the specific outcome for Nightingale at this point, but we do anticipate that once we are able to determine if the coursework and clinical hours meet the requirements for licensure in California, that there will be a clear path forward for either clearing deficiencies by reaching out to a different school or working with Nightingale to get that coursework cleared up. Additionally, the hope would be that if a school that is deemed not to meet California requirements for licensure, if they are aware of that, that they would do their best to communicate that out to their applicants from that state, that they don't meet licensure requirements so that they are aware of that. And it would also be, if their business model is to continue to enroll that state school, that they update their curriculum to bring it into alignment with that state's licensing requirements. Again, it is school-led, not Board of Nursing led.
This is Reza. I was going to wait till the end, but since we stopped on this one, I'll jump in as well. Just a couple little things to add. And first of all, let me take a step back from all this. Thank you to the committee members who didn't anticipate this discussion and are possibly hearing about some of this stuff for the first time. We've taken up a lot of the meeting with this. Obviously, as you can tell, this is a very important and urgent issue in front of the board, but we appreciate you kind of listening through it, and hopefully it's been informative and helpful. Another kind of just preliminary statement, to be very, very clear, the board is not, in no way are we like making a judgment call about Nightingale College or about applicants or graduates from the college, that it's, somehow inferior or anything like that. The board is very simply just doing an evaluation of what it perceives to be the requirements for, in-state schools, and whether Nightingale is teaching a course of instruction that's equivalent to that. And it just comes down to kind of a black and white, are they meeting it or not? But it's, the gentleman who spoke earlier about his reasons for that type of a program fitting for his situation. We completely understand that, and this isn't like a judgment thing in any kind of a way. That said, the last commenter spoke about having completed the program requirements in good faith and seeking a pathway without penalty. We absolutely recognize that the students who completed the curriculum did it in good faith and don't deserve a penalty of any kind, and are really kind of stuck in the middle of this. And this board's highest purpose is protection of the public, who we regard, the students who attend schools, amongst others, as members of the public, who we seek to protect. That said, the board, again, has kind of a black and white set of criteria that it needs to enforce, and what it deems required coursework, and that an out-of-state program must equivalently provide. It's just kind of black and white. So the board is not seeking to penalize anyone. We recognize the good faith that the students had in completing it, and the sacrifices that were made, all of that. And we're hopeful that we can reach a resolution of this that doesn't disrupt everyone's lives. That is very, very much the hope, but it'll come down to kind of what the determination is after really getting through the details of what Nightingale's coursework is like. One other thing about, clinicals within California being difficult to access and, that potentially limiting folks from being able to seek education. That's front and center in front of the board all the time. If you were listening earlier, the very first public comment that we had, which had nothing to do with Nightingale College, I assume, but it had very much to do with clinical impaction and the struggle to find clinical placements for in-state schools as well. So it's clinical placements is always a challenge. We're very well aware of that. It can be seen as kind of a bottleneck to the workforce. That's not unknown. It's a known issue, but the board still sees direct patient care as an essential part of training nurses and has established a minimum standard for that. So even though there are challenges in getting clinical placements, that's not to say that this board is willing to waive direct patient care as a requirement to train nurses. So yeah, that was it. And then the one other thing that I was going to say, Lori already kind of spoke to, but I'll just reiterate that the endorsement pathway, if you were to get licensed in another state, that doesn't guarantee your endorsement into California. The standards are the same. So I guess that's all I had for now. And
Thank you, Reza. I
Sure.
think we'll proceed with the next public commenter if there's still people on the list.
Lacey Kennedy. I'm sorry, Lacey Cassidy would like to make a comment. 1 second, please.
Lacey Cassidy is recognized, and please make your comment.
Hi. So my comment is that I personally know someone that graduated in April that has received their ATT. According to Nightingale, 11 people from that class have received their ATT. So I'm just wondering why they would receive theirs if this is still going on. And that's all. Thank you.
Thank you. Noted.
Thank-
And is there anything we need to respond to that? I don't think there is. Okay, so we'll go to the
I'd
next
like to
topic.
just go through the comments, make notes, and circle
Yes.
back at the end rather than
Thank you.
stopping on each one.
All right. I think that's the best way forward. All right. So thank you. And BRN moderator, is there anybody else on the list?
Connie Lafuente would like to make a comment. 1 second, please.
Connie Lafuente is recognized. Please make your comment.
Hello, everyone. I just want to share that I work with a consortium in the San Diego Imperial region, and I just want to ask the board to please be cautious in terms of continuing to accept new programs into our region, as the consortium is a membership of 200 members that belong to public and private schools as well as healthcare facilities. And we all are feeling the impact of the shortages on placements. And I just respectfully ask the board that we're not asking for all programs growth to stop, but we're asking for the board to match growth with capacity, continuing to grant new schools approvals to start programs in San Diego Imperial region before clinical placement capacity is ensured. It affects student success and the overall nursing workplace pipeline. So that's all what I wanted to say. Thank you.
Thank you for that.
Connie.
Next
And
comment.
then,
Thank you, Connie.
Connie, I would ask that you join the education licensing and education licensing committee next month, as well as the board meeting the following month for public comment at that point, please.
Thank you.
Thank you. Is there anybody else in the comment list?
There is
Gabriella.
Saji, so he's just board moderator. We'll just move through them.
All right,
Thank
thank you.
Gabriella Yagaldi would would like to make a comment. One second, please.
Moderator, just pause here real quick. Just
Yeah.
for a quick check on the timing. How many does it look like we've got?
31 at this point.
31 waiting to comment?
Correct.
No, 14.
14 now?
Yeah.
14 waiting. Okay, so that's fine. I'll take a quick pause on this, and we'll continue through the comments. No, we're going to do that, but just for the committee vice chair, you earlier asked about breaks and timing wise and all that. So we can just plow through the remaining 14 comments and any that come along. You can tweak the time limit if you feel like that's an issue. And then you can keep in mind if and when you want to insert a break.
Thank you. We can move forward and take a break at 12:30. So at least we can hear other comments that's already lined up.
Okay, we're going good at 2 minutes.
All right, thank you.
Gabriella Ugaldi.
Hi, good morning. I have just a quick question. I'm an LVN student. I'm sorry, I'm currently an LVN and I'm a student at Nightingale. Would my clinical hours that I did while I was in LVN school, would those count towards the patient care hours that California is requiring?
Reza, I have to jump in, sorry. Yeah, you kind of knew I would. Potentially, not necessarily by our board, but by your school. Your school could determine that in their admissions policy that they would accept those as experiential credit, which could be taken in lieu of requiring specific content. An example would be there's several programs in California that offer a LVN to RN step up degree path, and they give them credit for the entire first year. Typically, that entire first year includes OB and PEDS, and so that school has an experiential or transfer credit policy that they utilize on enrollment for that to occur. So that would be a determination by your school and how that curriculum is developed on whether or not your prior experience could be counted towards completion of the clinical and theory requirements that they require for their curriculum.
Okay, thank you. And then just to clarify, if I do test in Utah, you still have to review the curriculum to be accepted to endorse the RN license.
That is accurate, yes. So again, the reason that I said that if you guys were worried about the delay in getting the authorization to test, that you could apply in Utah is because we know that statistically speaking, the NCLEX pass rate drops considerably after 3 months from graduation. And so that would only be your pathway to be able to take the NCLEX. If that is something that you guys were concerned with. If you're still seeking licensure in California, your requirements remain the same, and we still have to complete our review for that. That review process, if it is decided at the point that everything makes, we would be able to meets the requirements, we'd be able to issue the authorization to test. If it is deemed that they don't meet requirements, we would not be able to issue the authorization to test, causing again more delay because you didn't meet our criteria. And so being mindful of the NCLEX requirement and that how important that test is, that is why I offered that as a potential ability to get the test out of the way and off your shoulders, and be able to kind of maintain those same pass rates that you would if you were able to test within the first 3 months. Because I know that for many applicants in California, we've gone past that 3-month mark and they have not been able to test. So I wanted just to kind of give a secure pathway for that to be addressed, but not for licensure in California.
Okay.
This is Reza. I want to make sure that the information was complete and clear. You mentioned that the clinicals that she did during her LVN coursework could be considered by an RN school towards credits that the RN school accepts. But those clinicals during LVN school, for example, wouldn't count towards the 500-hour requirement that we've got due to the concurrency requirement and potentially other things. So as far as licensure.
Correct. The only caveat is if we do so real quick, Reza, if we do a comparison that this, say, California approved nursing program, I'll use an example. So school A in California has a approved generic curriculum. And part of that requirement that we have is that you must evaluate for transfer credit and grant credit, both for nursing as well as general education. If a school on their enrollment says, we are not going to require PEDS and OB for an LVN to RN step up, and that is how their curriculum is approved, we would not require those hours to be made up in different content areas. If their generic curriculum has hours contributed to OB and PEDS that made up that 500 hours, we would then allow for that credit towards that 500 hours by looking at their enrollment agreement and their curriculum plan for their LVN to RN step up. So if it is allowed as a transfer credit on enrollment, and again, that's the key, it is an agreement on enrollment. It is not an agreement after the fact. It is an agreement on enrollment and it's part of your course plan, then that credit can be given. That is what we currently do in California. And so there are programs out there throughout the state that do an LVN to RN step up, and their curriculum clearly defines which content is allowable in that accelerated or advanced placement option, and we review it against their general curriculum to ensure that it all aligns. But it is on enrollment. It is not after enrollment, and it is not after graduation. We have to align with the Title IV.
So
I'm sorry.
real quick,
One more
Mr.
question.
I'm sorry that we're in the weeds on this, but just to kind of wrap this one up, what I'm hypothetically envisioning is a scenario where, let's say it's determined that hypothetically Nightingale generally doesn't meet the 500-hour requirement that this board has for direct patient care, and that the pending applicants get deficiencies for that reason. Could an applicant say, well, I addressed this deficiency because I did additional clinicals during my LVN coursework? In that limited hypothetical scenario, I think those clinicals from LVN school are not going to carry over to help you get licensed in California. So
that is accurate, Reza. Yes. And Nightingale does offer two pathways, one for an LVN and I believe one for a medic. And those currently are being reviewed too to see if there's any possibility for that to occur. And that is something that we are looking at, but that is not looked at after the fact, if that makes sense. So it is in alignment with what you're saying, Reza.
So one last question is, if we do have to redo or if we have to do more clinical hours based on what you guys find that Nightingale's curriculum is missing, we have to redo also theory? Is that correct? Or we could just do clinicals?
In our law, it requires concurrent theory with clinical. And that means you would enroll in another semester. You would take a theory component that would complement the clinical practice that you are about to do. Schools can develop that in a way that meets that requirement. It doesn't have a specific hour requirement for that. Only the clinical has the specific hour requirement unless a school is deficient in theoretic coursework as well. If they're deficient in the theoretical coursework as well, say by one semester credit or 2 semester credits, then the hope would be is that they would make a 1 or 2 semester theory unit that would complement the missing or deficient clinical requirement too. And so both of those would be done in the same semester or quarter, depending on how your curriculum's developed.
All right. I think we reached 12:31. I think we will have to request for a recess. My question is how long? 10 to 15 minutes? Is that reasonable for everybody?
We can do 12:45.
All right,
come back.
12:45. All right, we'll
you,
come
guys.
back in at 12:45. Thank you so much.
And to be clear, I presume we're going to pick up where we left off with public comment.
Correct.
Okay.
Yes. Yep. Thank you.
Thank you. Hi, everyone. Welcome back. Should we do a roll call and get the quorum?
Yes, please.
All right. So let me just get my list. All right, welcome back to everyone. And I'm doing the roll call to make sure that we have the quorum. I'll start with myself, Sajid De Guzman. I'm here, present. Dr. Tommy Von Hall. No. Sherry Fortin.
Present.
Wendy Hansborough.
Present.
Thank you. Alice Benjamin.
Present.
Dr. Hazel Torres.
Present.
Judy Cornell. Christopher Harkins.
Present.
Jacqueline Bowman. Not here. Ariel Hernandez.
Present.
Thank you. Chris Perry. No. Dr. Juan Spetz. No. And
Present.
thank you. And Dr. Matthew Hubbs.
Present.
Thank you. All right. Moderator, do we have quorum?
Thank you. You do have quorum. Welcome back.
All right. Thank you.
We are going to move to BRN HQ in person. So we'll have a little movement here. If we could have the next commenter come up to the microphone in BRN HQ.
While we wait for that, this is Reza, Board Counsel. Just a quick procedural requirement for our committee members. Under Bagley-Keene, we've got to ask you all to have your video cameras on to count towards quorum, unless you've got like a bandwidth issue or some technological problems. So just a reminder as we go forward. And then moderator, we're taking the in-person comments. Is that right?
Yes. Yes. The in-person people have to leave.
Oh.
Well,
Thank you for the
gladly.
reminder then. So everybody, all the members of the committee are advised to turn on their cameras. All right. So I think the public commenter from the BRN HQ is not, or is no longer available for commenting. So I think we can move forward with the next public comment.
Oh, nope.
No, they're at the table.
They're
Right
sitting
there.
at the table.
Yep.
Oh, sorry. Oh, there you go. All
Hello.
right. We can move ahead with the public commenter. Thank you.
Good afternoon, ladies and gentlemen of the committee. My name is Jacob Balatori, and I have been an LVN for the past 8 years, serving California's Central Valley. My career spans over 2 areas of care, emergency rooms, and our jails. I have proudly served my community, so much so that I went back to school and earned my Bachelor's of Science in Nursing from Nightingale College of Utah. I am here today to bring to light a situation that is ongoing between the BRN and Nightingale College. I will say this, I know that speaking here today, my grievance will not be resolved. However, I believe the situation plays a direct role into the topics that will be discussed today or in future committee meetings. Personally, this isn't abstract. I have signed an agreement to start as an RN in my hospital's emergency department on August 24th, a role my community needs filled, and I currently cannot schedule the exam that would let me begin. Discussions between the board and the school began in March of 2026, and by mid-May, the board had formally flagged concerns about direct patient care hours and requested more information from the school. The school has submitted all information requested by the BRN, but has not yet completed its review, nor have they provided a timeline as to how long this would take. The board has told me this type of review, I'm going to skip past this. The nursing shortage has been no secret here in California. However, an even greater issue remains, and is the lack of space that California nursing programs can provide. I did not spend 8 years as an LVN for no reason. During those 8 years, I spent time and time again trying to get accepted into a California nursing program, even to the ones I could not afford, like some of the private nursing programs available to me, which is why I and so many other Californians looked to out-of-state schools like Nightingale College because we were left with no choice. Already 10 seconds. Yeah. Nightingale College has produced many Californians nurses in its time. I know because I work side by side with them, and they are more than qualified nurses. Distance nursing programs like the one offered at Nightingale College respond to California's RN shortage and nursing education crisis by allowing experienced nurses like myself with years of experience in our specialties to serve at a greater capacity. Furthermore, it opens a pathway to higher education for students who may have families, cannot afford to go full-time in school, or who were denied admission to a nursing program, not because they weren't qualified or because they didn't meet their benchmarks, but because there was no room for them. I'd ask this committee to consider adding curriculum equivalency review timelines and consistency standards to a future agenda, perhaps as part of the clinical placement and impaction or curriculum standards subcommittees already on today's docket. Applicants like me deserve a process that is not eventually fair, but predictably fair. I hope that in discussions on the standards, we see out-of-state nursing institutions not as unqualified or looked at differently because we didn't attend a traditional California nursing program. We are students who had to make our own path. We are here, we are proud nursing graduates, and we are ready to answer California's call and serve our communities. Thank you.
Thank you.
Thank you.
Any?
Is that, do we have any others? Oh,
We have one more, yes.
thank you.
Hello, good afternoon, Chair and members of the Nursing Education Workforce Advisory Committee. My name is Nina Stevenson. I'm a registered nurse. I'm also a California nurse educator. I'm a continuing education provider, and I'm the founder of My School Needed Nurses, Continuing Education and the Creative Smart Nursing AI curriculum designed for nurses. I want to thank you today for the opportunity to speak. My comments are in response to today's discussion on the agenda, item 8.5, workforce retention, curriculum standards and guidelines, and agenda item 10.0 as well, about regional forecasts of the registered nurse workforce. As healthcare continues to evolve, I believe California has the opportunity to lead the nation in preparing nurses to safely and effectively use artificial intelligence in clinical practices. AI is already transforming healthcare through clinical documentation, patient education, virtual patient monitoring, workforce automation, clinical decision support. However, many nurses have not received formal education on how to use these technologies responsibly. Over the past several years, I've actually had the ability to develop an AI nurse professional educational program that teaches nurses how to safely integrate AI into patient care and clinical practice. Our curriculum has already been integrated into some nursing educational programs in the state of Illinois. Graduates have actually been accepted to AI-focused nursing positions, and participants have even developed healthcare applications designed to improve patient outcomes. As I listened to today's discussion, I wondered whether the committee has considered developing AI nursing competencies or specialized certificate pathways for our California nurses. I also encourage the board to explore whether evidence-based AI stimulation and competency training could complement nursing education as California continues addressing the workforce preparation and clinical placement challenges. I'm not asking the committee to approve my program today. Rather, I hope to begin the conversation about how California can establish educational standards that will prepare nurses for the future of healthcare. I understand this topic may be better suited for a further advisory committee or board meeting, and I plan to attend those meetings as well. I would welcome the opportunity to collaborate with the board, nursing educators, healthcare organizations, and stakeholders to help develop evidence-based AI competencies for our California nurses. Thank you.
Thank you.
Thank you. Don't go
Thank
yet.
you.
Don't go yet. I'm going to respond to you really quick.
Can I get her name also? I mean, sorry, if I want to get the name of the speaker.
My name is Nina M. Stevenson, Nina Maria Stevenson.
That aligns with my AI and curriculum subcommittee, so I might want to connect with you.
Okay, that's
Thank
good.
you.
Yes, thank you.
Yeah, a couple of things. I would ask you to email me directly so we could set up a meeting. I know that Macaulay Fusarians and Marissa Clark are both there in the room, so if you want to get my contact information from them, you can, but it's also on the website at loretta.melby@dca.ca.gov. Additionally, if your content is post-licensure, we have no jurisdiction over it. You're able to do any post-licensure curriculum outside of our approval process. If it is a specialty certificate, we do not have jurisdiction over that as well. And so you are able to do that outside of BRN. if you're wanting AI to be part of the pre-licensure nursing curriculum, that is up to every individual school. We set minimum standards, not maximum standards. And so if they want to include AI in their curriculum, they can. They can do that in a manner that they put forth in their curriculum plan, so we're aware of it, and it can move forward. We have no regulation that says they cannot use AI for simulation. So I'll be very clear with that one too as well. We allow for non-direct patient care clinical hours in part of meeting our minimum licensing requirements. Kind of the discussion here with Nightingale is that we only require 500 of the 18 semester units for clinical hours to be done in a direct patient care fashion. That allows for greater than 400 hours, or right about 400 hours, sorry, to be done in any means as long as it meets the clinical objectives. If a school wants to use AI as part of their simulation or whatever, they can currently do that today without any regulatory or law change. So just wanted to give you guys that information as a heads up. And please reach out, talk to me. We'll get you connected with Saji as well, and we could have more conversations offline. Thank you.
Thank you.
Thank you. Thank you.
Yeah, this is Reza, Board Counsel, that I'll throw in. As Lori said, we have no jurisdiction over post-licensure education. The one kind of tiny little carve out there is continuing education courses, which I'm not sure if the last speaker is a CE provider, but that's one carve out.
I believe she is. Actually,
Yeah,
I think
so
I'm familiar.
that's why it occurred to me.
Yeah, she is an approved California CE provider as far as I'm aware. So yes.
Thank you. BRN moderator, do we still have somebody in the comment list?
Do we have any more comments from BRNHQ?
No, we are good on comments here in headquarters.
Perfect. Thank you. Sierra would like to make a comment. 1 second, please.
Sierra is recognized.
Sierra, on your screen, if you have many windows open, it's a small window that will be behind them, and it would say unmute yourself or unmute me. I'm sorry. Okay, Sierra does not appear to cannot unmute herself or not. We'll circle back to Sierra. Kayla Bryant would like to make a comment. 1 second, please.
Hi, hello. I guess I just need some clarification as to what's going on with the equivalency. And so what you were saying earlier, because I do remember what each one of you were saying about the reason why the school for Nightingale, I'm a Nightingale student in California, you were stating that the school was first brought under investigation when you guys found out about, I guess, one student's application. Does that sound familiar?
No, sorry. I think what we were trying to clarify is that we review every person's application, and then we look at the curriculum assigned to that person's application to make sure they meet our licensing requirements. That is not, it wasn't one applicant that led us to looking at Nightingale's curriculum.
Okay.
That's
I guess I would say I'm just a little bit more so confused because there's been over 1,000 students who've graduated from Nightingale and are working in the field who we know personally as well. So I guess I'm just trying to get some clarification as to exactly what is being reviewed. I know you guys said the clinical hours, so I just wanted a little bit of clarification on that.
We're reviewing the entire coursework, clinical and theory. For licensure.
And what okay, and what exactly brought that up? Being that there's been so many students who's graduated from Nightingale, all of a sudden you guys just looked into the curriculum. Is that what I'm hearing?
This is Reza, the board's legal counsel. As I said, I'm sorry, we're not going to be going back and forth and addressing every question going forwards. We've got quite a few
Okay.
comments still, and I apologize, but I will speak to that. This wasn't just prompted by a review of one person's application.
Okay.
And the fact that there are graduates who have gotten licensure doesn't preclude this board from acting on information that it's received. The board's received information that calls into question whether Nightingale's current course of instruction meets
Got
the
it.
board's standards, including the 500-hour minimum for direct patient care clinical training. So we've received several sources of information that kind of call into question the clinicals and all that. At this time, we're walking kind of a thin line, because not wanting to say that it definitively doesn't comply with the board's requirements, because that's still under review, and we're not quite there yet. But the board has received information that legitimately causes it to call that into question. So the fact that there were prior graduates, as I said, the board doesn't. Nightingale is not one of the schools that's under the board's kind of day-to-day jurisdiction that they have to send every change they make to the board. But as soon as the board received information that called into question, it had to kind of take action. So that's where, there are some graduates that in the past have been licensed by this board. The timing,
Thank you for that information. And just to be clear, you guys are saying that there's no time frame as to when this will be resolved. Also, I just wanted to know, I know that you guys are looking into this. I just kind of wanted some reassurance that California students do have a chance, or will have that moment to where they can sit for the NCLEX and get the ATT. Are you guys saying that that's completely in the air as of right now, and to just keep being, updated and just keep looking for, announcements from you guys, or what?
What I would say is, unfortunately, given the issues I talked about earlier, and how it could get resolved pretty straightforwardly, or it could be a more complicated resolution. The time frame, we can't speak to that. We wish we could. We want to address everyone's anxiety and concerns, but it wouldn't be responsible for us to give a time frame at this point, other than just knowing we're working as quickly as we can to get this resolved, knowing the pressure that you all are facing. As far as your pathway, I think it could probably, and I'm speaking off the cuff here, but I think that one of the few outcomes is to be expected, and don't assume that there's any particular likelihood of one or the other, or any weight that I'm giving to it. One, we could get the information from Nightingale that we need, determine, okay, they do appear to comply. They do appear to meet the California minimum standards, and everyone who's on hold can get approved right away. Another possibility is we find out, okay, Nightingale's coursework doesn't meet California standards in this particular specific way. And once that determination, if that determination is made kind of as a final matter, then all of the applicants who are currently affected by this and on hold will get notified and say, this is the determination that was made. This is the deficiency in your coursework. And then you can go ahead and clear that deficiency. As Loretta said earlier, they're just speaking in general, when there are deficiencies in coursework from an out-of-state school, she gave an example. The graduates or the students can go and make up that deficiency. So right now we're
well, I don't want you to just ramble on, because I don't want to waste your time or my time. So basically what you're saying is, if there is a discrepancy, those California graduates who are in the field now, they do have a chance to go back and correct that deficiency so that they're able to move on in their career. Is that what you're saying?
Yes.
Okay, cool. And then in regards to the next step, as far as us graduates who are actually in Nightingale and almost to the finish line, being that you said there is a discrepancy that you guys are looking into right now, can you reassure us that, okay, you guys are reviewing this, you guys have no timeline as to when this will be resolved, but there's 100% a chance, or most likely, that we will be able to sit for the NCLEX. It's just right now we don't know.
Well, so 100%, it's you're gonna have a hard time getting a lawyer to say anything's 100%. That
Okay.
said, our usual process is if there is any deficiency, we let you know what it is so that you can make it up,
Okay.
whether at Nightingale or at another school. So
Right.
you can say we will get you an answer as soon as possible as to whether you can proceed as is with the court,
Uh-huh.
the coursework you're taking as they've currently structured it, or whether
Mhm.
there's some deficiency that you may need to correct. And I'll just to manage expectations, there's a possibility that that deficiency could be not a small, insignificant thing. As Loretta said, it might mean going back to school for, another semester, possibly more. I don't, at this point, can't
It's
say what
you
the
can't say.
magnitude of
Okay.
that is. But
Okay.
whatever it is, there is a pathway to get it resolved and
To
get
get it resolved.
licensed.
Okay. Well, thank you so much.
Thank you.
No
Just for
problem.
everybody on the call, I just want to let everybody know our goal is to get you guys licensed here in California. That is what we're looking at on this curriculum. We are trying to find equivalencies in any manner possible to make sure that you meet our licensing requirements. We have a law that we have to make sure that we're equivalent with. If we are able to determine that you're equivalent, which we are desperately trying to do, you would be able to be licensed here on that in that put into that pathway for licensure by getting granted your authorization to test. It is only if we're not able to find the equivalencies where we will let you and your school know. But the goal is always for licensure. There is never a time in California that we're trying to bar anybody, international, out of state, or anything from coming into California if you're able to meet our licensing requirements. Specifically with you guys being California residents already. So our goal is licensure, and that is what we're trying to get you guys to. And whether that is finding that Nightingale does meet the curriculum, that'd be great. If we do find that Nightingale does not, we will give Nightingale a very clear path on how they can meet that. And we would hope that Nightingale will work with us to make that happen for all of you guys as well.
All right, thank you. And anybody else that we have comment on the list?
Melody Daniels would like to make a comment. 1 second, please.
Hi, this is Melody Daniels. Hi, Lori. It's good to hear you again. I actually just put a comment in there, but I do want to speak to the fact that we are definitely impacted. I completely agree with Samantha Gerard's comment earlier that we just don't have enough clinical placements. I work for Sharp Healthcare, and we currently place nursing students at the highest rate of anyone in the county. We had over 2,900 nursing students just last year, and it's very difficult to place them. We always try to give a reason, but often we're not able to find spots. In addition, for our latest nursing residency program, I know for a very limited number of spots, we had thousands of applications, and of course, we are not able to accommodate that many. So currently, we're not experiencing that work shortage for nursing that we have in the past. Not to say it's not going to happen again, but still, I would be cautious because I know many of the individuals many of the schools have programs that they have not been able to actually open up, and they're already approved. So I really hope that the board would consider to really make the programs that we currently have more robust. In addition, I think that clinical faculty is really a big problem. I have had many communicate that clinical faculty are not available to be able to do the afternoon and evening shifts, even if they are available. So I would really encourage, encourage, you know, education, training of additional clinical faculty and really bringing to light that those afternoon and evening shifts may be options to kind of help with this. So thank you for letting me comment, and it's back to you. Thanks.
Thank you, Melody. And then just for clarity for everybody on here, I used to work with Melody in my past life before I became the EO of the BRN. And so, Melody, one thing I just want to make sure that you're aware of, we have board committee meeting for education licensing coming up on August 11th. I ask that you come and public comment that day, as well as we have our board meeting on September 24th and 25th. Those are the more appropriate meetings for these kind of discussions, because those are the ones making the decisions on enrollment growth, et cetera. One thing to put out there, though, is our board cannot impose a moratorium on growth. But we do have the ability to evaluate impact and look at success measures of schools. But the other thing I want to share with you is on our website under education, if you go into the, trying to find what it is, it's a nursing faculty. The one thing that California has that no other state has with nursing faculty is we allow a pathway into nursing. And so if you all have an RN license, it does not matter your degree type. If you have an RN license and 1 year of RN experience, you can be what's called a clinical teaching assistant. That clinical teaching assistant can get approved as faculty and can assist in the laboratory settings as well as assist in the clinical settings. If you have a bachelor's degree and 1 year experience, you can actually become an assistant instructor. You can get a faculty approval, become assistant instructor. You can take your own clinical group to a healthcare facility and complete clinicals, as well as co-teach in a theoretic classroom or online, hybrid, any kind of situation, as long as you have a lead instructor that you report to, and that lead instructor is the one that's responsible for grading, et cetera. And then our next requirement, of course, is a master's degree. And that master's degree is required for the instructor, the lead instructor, the content expert, as well as any kind of nursing program administration, which would be the assistant director or director. So we in California have a pathway in so that we can attract more people into academia and utilize kind of a team teaching approach. And so you don't have to be associated with a school to be able to do that. Go onto your Breeze account if you're an RN, and you can apply directly for faculty and get approved, and it will be associated with your license. So trying our best to deal with any kind of faculty crisis. We do know there's a lot of that in California.
California, yeah. Thank you so much, Loretta. Appreciate you.
Thank you. You're welcome.
Thank you.
Valeria Alas would like to make a comment. 1 second, please.
Hello.
Yes, ma'am. Go ahead.
Can you hear me?
Yes.
Okay, thank you. As many of us that are here today, I am a California student currently at Nightingale College. I am on my 3rd semester, and I'm a very proud student of Nightingale. I have learned so much from this school. I have had excellent teachers and people that have supported me throughout this path in nursing. I am currently an LVN, expecting to become soon an RN. And as many of my fellow students and friends that I have made along the way, my path here, I am concerned because, you know, this has been a huge investment, a huge sacrifice. I am a mother of 3, and I'm not speaking from an emotional standpoint. I am speaking from a factual way. Our tuition is $70,000 plus for the people that are trying to do LVN to RN. Plus, as you may know, we have to fly out of state to do our clinicals because unfortunately we're not able to do them in California. This is an additional burden to, you know, our pockets, and a lot of us are studying and working at the same time. So to make my point clear, we have not been receiving communication from the school up until earlier this month. That is the reason why many of us are concerned, because we were just referred to one website that has a timeline, and the timeline started on February 23rd this year. So from February 23rd this year, we haven't heard anything up until recently. And that is the reason of our concern, because we were not listening, we were not hearing anything from you guys, and we didn't hear anything from the school. So we were just hearing speculations on websites, everything. So that made us scared. And on this website, I'm quoting what it says on the website. It says, when the BRN made its original information request from our college, the request was connected to one graduate's ATT application. Soon after that, the BRN began holding other graduates' applications as well. But at that point, the BRN's request still was associated with that student particular application. However, even after this graduate received an ATT and became licensed, the BRN began holding additional ATT applications. So more than just, like talking and talking and talking here, I am actually making a plea to you guys kindly. I know that you guys have, spent so much time with us here today, but I want you guys to understand our side too. We are human beings. A lot of us are parents, and a lot of us are trying our best so we can serve our community. Because at the end of the day, this job is a calling.
Thank you for your comment. Please be reminded that we are at a 2-minute limit. I'm going to circle back to Sierra. Sierra.
Absolutely. Okay, can you guys hear me now?
There you go. Welcome.
Oh my gosh, I could not figure it out. So I've just been kind of popping in and out throughout the day during this meeting, and it might have been addressed already, might have not. I guess my biggest concern is, and I mean, I get that veterans have a different status than most of us applicants in California. They have priority from my understandings. But we've been told that there was that number 10 or whatever from our graduating cohort in April that have been able to sit and test. And I guess my question and concern is how one student with the exact same education as us are able to sit and get licensed in our state, while there are many other of us at the exact same school, exact same level, and ours are being held. If the school is under review, how is it possible to authorize somebody to test and not another? What is the difference in their authorization versus us that are still waiting is what I'm wondering.
We're not able to speculate on individual applicants as we would
Not
have to do it.
anybody specifically, just like very generalized. Why would one person from a school be authorized for a school that's under investigation, but not another? No specific people, but what could change that criteria, just so we know why that could be?
I could not speculate on that. All we do is we look at every application on an individual basis. There could be additional coursework or something that was included that another person may not have had. I do not know and could not speculate on that.
This is Reza. The only thing I can say that most likely is the difference is timing. And it's not it's not a fair thing that somebody from the same, school with the same curriculum got approved and the next person didn't because of when the board started holding these applications. But it's just the reality of it. Timing is a big part of when the board effectively stopped approving graduates from Nightingale pending resolution of this. There may be kind of one-off situations apart from that where somebody had some other coursework or something like that, which may be kind of more of the unique situations, but timing is a big part of it. And we're not saying that it's fair that somebody didn't get approved when somebody else with the same education, not that long prior, did get approved. But it's at some point the board has to kind of take action and cut things off until it's resolved. And that's where we're at.
Okay, so last concern, and this is something that I've also heard that I'd like clarification on, is that those students that did get lucky, whether it be their timing or whatever their reasons are, if we end up not getting the results that we're hoping for, those students that graduated with us in April that have gotten their ATT and are now working as RNs, do their license stay active although they are Nightingale graduates, or do they have to go back and finish the same things that we would have to? You're muted.
Thank you. I don't have an answer to that. The folks who are, I mean, the biggest priority right now is completing this review, and the folks who are on hold, the folks who have already gotten authorizations to test. I can say we're not at this time looking to reverse that action. We haven't really, that's not, we're not there yet. So I don't have an answer to those folks who are happen to get their authorizations to test. But the first, I think, priority is the folks who are on hold, and you know.
I was just wondering if that would benefit us in any way, in the aspect that, oh, hey, these people are still working as an RN, even though for our bachelor's degree program, we all did the same coursework, the same DFC travels, the same clinical hours. Since you guys previously stated that those of us that are LVNs first, that those hours do not transfer in, then any hours that were being offered to us in this program, theoretically, we would all have the exact same hours if LVN hours are not counted.
Sorry, I'm not sure what is that.
And we exceeded the 2-minute timeline, so we're moving to the next caller.
Let's move forward.
Joshua Barsati would like to make a comment. 1 second, please.
Good morning, committee and council. Like everyone else here, most of us were all from Nightingale. A lot of my questions have been answered with previous students. My I guess big question would be, if I do decide to go and get licensure in a different state in regards to the situation with Nightingale and the board, when applying for endorsement, I guess what I can ask is, am I put into a different bracket in regards to the application process, or is it along the same lines as the initial application process for the state of California?
The requirements are the same whether you endorse it or not. Sorry, I'm going to interrupt here. We are at 1:23. We are scheduled to go until 2 o'clock. We have not managed to get to any of our agenda items that are on the schedule for today. We are required to take public comment. That is a requirement, so we will continue with public comment. I do want to let the committee members know that according to board moderator, we still have 13 more to go. So I do not see us getting to our agenda items today. What we will do is I will coordinate with BRN staff. We'll reach out to you guys as well, and we will schedule a redo of this meeting so that we can get to our agenda items. I don't know when that will be. We'll reach out for availability from all the members here, and we will move this current agenda as written to a next agenda. I do believe that this public comment session is very important. I appreciate all of your guys' time here. I think ultimately it does help us with our NEWAC conversations as we move forward in the future. as we look at clinical placements, as we look at curriculum, as we look at everything. So I'm grateful for this today, but I just want to give a kind of a heads up to our committee members that it looks like we will just be having an additional NEWAC committee. We will schedule that out. We will have the same agenda as we had today, but we will end promptly at 2 p.m. today. And we will do our best to get through the next 13 people that are here for public comment for items that are not on the agenda. Thank you.
Just a clarification from the chair, Loretta. So regarding that, so when we continue with the next, and if you reschedule this agenda, this meeting for NEWAC, are we continuing on, or are we also getting back to the public comments agenda next time?
We have to have public comment on the agenda for every committee we schedule. So if we have people show up in public comment, we will have to take public comment. That is a requirement as a public agency that we do so. We're hoping that we've answered enough questions today. We're hoping that we're given enough information for the Education License Committee meeting as well as our board meeting as other options, that it would not affect this advisory committee again. But if the public shows up, we are required to hear, and that is what we're doing today. I do hope that we have some kind of review outcome before the committee meeting or board meeting, so that we do have a path forward for these people. That is our goal. As I said at the very beginning, this is the top priority and the only priority right now for school curriculum review for equivalency.
All right, sounds good. Taken. Thank you.
This is Reza. Just wanted to add. So all of what Lori said is fine. We can just carry on with public comment here and reschedule a NEWAC meeting. Of course, with the possibility that we may get more public comment on this issue in a future NEWAC meeting. I did want to offer, though, that it is an option if, we could limit public comment or proceed to this committee's agenda items and then circle back to public comment if there is any time. Lori, if you wanted to try to get through this committee's agenda items.
The committee's agenda items today were very kind of succinct, mostly routine. We did have Joanne's presentation. I do not believe that we can get through Joanne's presentation and the discussion around that. And honestly, at the very beginning, because Joanne was not present, I did remove that agenda item. And said we would put it on the next one. That was agenda item 10.0, because I was under the understanding that she was not going to be able to attend. So I'm comfortable with just allowing public comment to continue for the next 30 minutes, adjourning, and then reaching out to reschedule this current content. And if there's additional content at that point that our vice chair would like to add, and we'll do a reach out, we'll expand that agenda if needed.
All right. I was thinking of approving the minutes from the last one, but if we decided to complete with the public comments, then I think
it's okay.
That's the way
Yeah, we can approve 2 sets of minutes.
Yeah.
And the next one's totally fine.
Good. All right. We can move ahead and continue with the public comments. BRN moderator, please.
Okay, did we get through Joshua, or was he? I think you cut him.
We got through. He had asked if he applies for endorsement, does he end up in a different bracket for the application process? Loretta had started to, I think that was the end of his comment, and Lori had started to respond. I may have kind of gone off on it.
No, I had said that they're held to the same requirements, whether it's endorsement or exam. It doesn't put them
educationally, the requirements are going to be the same. And then, internally processing wise, there might be, a different set of hands that gets it instead of.
It also goes through U.S. evaluations. Yeah, okay. It goes through a U.S. evaluations unit. The same type of employee, whether it's the same person or not, would handle it. So it is the same review process, whether it's endorsement or exam. The only difference is you don't have to take the NCLEX, but everything else is identical because
Perfect.
The NCLEX has already been taken and passed.
Okay, thank you. Candace would like to make a comment. 1 second, please.
Hi, hello, can you hear me?
Yes, ma'am. Go ahead. Sorry.
Hi, I just first of all want to thank all of you for taking your time to answer many of us Nightingale students' questions. I'm going to keep my question pretty short and simple. It's directed towards Reza. You kind of clarified it a little bit, but can you please give us some transparency here? What is the exact deficiencies? Nightingale has given us a very vague timeline, like a week and a half ago. We barely know what's going on. This has been going on since February. I'm about to graduate. Many of us are scared. Please just tell us what the deficiencies are.
So I'll jump in real quick. Rez is not the one that's doing the evaluation. I am, and I'm working with him. We have not identified exact deficiencies to date because we just received new information from your school last week to review.
The one thing that I can and I'm willing to say, the deficiencies, Loretta pulled up a regulation on screen earlier, section 1426 of our regulations, which specifies our coursework requirements and all that. In addition to that, we have a statute that spells out the 500-hour direct patient care requirement. That 500-hour requirement is right now, I'll just say, a kind of significant elephant in the room between us and Nightingale. They have taken the position that the BRN can't hold Nightingale graduates to that requirement. And I think they've taken the position that, well, even if you can, we have all these hours. So there's a two-step kind of process on that piece alone, which is, I think, a big piece of it, that sorting out, as I said, the board, take the position that the 500-hour requirement does apply. So if Nightingale graduates take the position that it does not, then we're kind of legally at odds, and that tends to get resolved through litigation. So that's one possibility. I think they, as Lori said, they recently submitted some additional information just last week. So there's a couple of things going on. One is discussing the legal requirement of that 500-hour requirement, and two, looking at the actual courses to see, do they have enough units of this, that are the units concurrent with one another as required, and so all of that stuff, the kind of specifics of like, do they have enough units of this and that I'm not able to speak off the top of my head here. And I think that stuff is still a little bit more kind of just being reviewed and sorted out. Whereas the 500-hour thing, they've come out pretty explicitly and said, we take the position that this doesn't apply to graduates of out-of-state schools. That's one where it's just kind of definitive, and I can say that's a significant elephant in the room. Best case scenario, as I said, this can go a variety of different ways, and that's why we're not able to give you the clear timeline and the clear path forward that we really, truly do want to give you. But the best case scenario is they reach a point where they either agree with us or concede that the 500 hours requirement does apply or can be applied to out-of-state grads like Nightingale's, and they show us that their students did in fact have that many hours. That's the best case scenario, where we can say, okay, they showed us the equivalency. Worst case scenario is they dispute that, it ends up in court, and that's a lengthy process, and a court would decide whether the BRN is correct in applying that requirement or not. And so it's it's not a nice, clean situation that I can present to you with just a very straightforward resolution and path forward. Unfortunately, I hate to say it. So your question was exactly what are the deficiencies? I haven't mentioned every little thing that's been discussed, but I've mentioned at least what I consider to be the one of the giant kind of elephant sitting in the room that is not really, neither side is really all that ambiguous about kind of where they're at on that. But even
Thank you
now,
for clarifying. I really appreciate it because we have been left in the dark here. And so I just want to say thank you for clarifying the real deficiencies.
Sure.
And just so you're clear, that's not all of the deficiencies, right? When I started this review process, I was not able to find many of the items listed in 1426. It doesn't mean they weren't there. It just means that of the information that was provided to me, I was not able to locate them. So we did reach back out. We've asked for additional information. I'm hoping to be able to find a lot of the things that I was not able to find on initial review. Some of those being a mental health course or a geriatric course that included clinicals. We do know that your curriculum is not a standard med-surg OBP psych mental health and geri, that you do a more of a concept-based curriculum, and that's fine. We have California approved programs that have concept-based curriculums as well, but they do have a course map with threads that show where each of that content is covered within those concept-based courses. And so in the initial review, we were not able to find a lot of the things that are outlined in 1426. We are hoping on continued review that we're able to clear those up, but I cannot guarantee that we would. Additionally, we require 18 units of clinicals and 18 units of theory as course minimum requirements for licensure for semester units. In my initial review, I was not able to find 18 semester units of clinical or 18, and so that was something that was brought up too. It doesn't mean it's not there. It just means I wasn't able to find it on the information that was submitted to me for review. So there is at minimum the 500-hour that Reza is sharing. I do not know about the other deficiencies that potentially are there based on the information that was just provided. I'm hoping to clear up many of them and give Nightingale a path forward.
All right, so that's, I think the question has been answered. So let's move forward to the next commenter.
Janet Izazaga would like to make a comment. 1 second, please. Sorry if I chewed up that name. That is a great name, by the way.
Hi, thank you. My name is Janet Isasaga. I am a recent graduate from Nightingale in April. I understand that a lot of questions have been answered. Can I know when was the last meeting with Nightingale? I know Loretta said they're reviewing stuff they received from them. When is your next meeting? Who's your contact there at Nightingale? And how many applications do you currently have that are on hold? Because I would like to know, all of us paid for our application, so I want to know how many applications are you currently holding from Nightingale? And one last comment, we all received different information from the evaluators on our emails, and so that made it very difficult as well. I think all the evaluators should be informed of the same information because everybody kept telling people different stuff, and that made it really hard. And I understand that every application is individual, but again, if it's the clinical hours that are in question, those 11 applicants got approved because they had those 500 clinical hours. So why aren't we getting approved?
So we have sent messaging out to our licensing team as well as our call center team and executive leadership. We should have consistent messaging. If you're not getting consistent messaging, I do want to apologize for that. And it looks like it's a training issue on our side that needs to be addressed because you should be getting consistent messaging. I received information from Nightingale as well as Reza last week. I plan to get that reviewed and be responsive as quickly as possible. Based on our responsiveness back to Nightingale, we'll either get more information or a meeting request. I cannot determine that, but it isn't our court per se, as they just recently gave me information last week. As soon as I get that review done, we will be responding back to Nightingale.
Okay, and then do we know how many applicants you have on hold right now from Nightingale?
we receive well over about 60,000 applications in a year. I would not be able to have that off the top of my head. I would have to pull a report. That is something that can be done through a Public Records Act request, but I do not have that information off the top of my head right now. But we are, again, putting Nightingale at the top for this review so that hopefully we can come to some kind of resolution and get this addressed.
Okay, thank you, Loretta.
Also, she asked who is speaking, who's communicating. Nightingale has their own in-house counsel, and they've retained outside counsel named Edward Cramp. He's once they've retained an attorney, all communication has to go through their attorney, and that's who is corresponding with us, and that's who we correspond with. And he's the one that's kind of our primary point of contact who relays things back and forth.
Thank you, Ressa.
Yeah, and we're hopeful that once Loretta's review of the most recent information is complete, we envision anyways circling back with the representatives of Nightingale and saying, here's what we found, and possibly conducting a meeting and going from there. In the past, I think we had a large meeting a few months ago, and since then, any correspondence was exchanged through email and just dialogue that way.
Thank you for your comment.
Both.
Thank you. Noemi O would like to make a comment. 1 second, please.
So I just want to kind of, I guess, I'm really saying the same thing as other people. But I do want this to be noted that I myself, as a mother of two, there would have been no way that I would ever be able to pursue higher education had it not been for this school. I've worked in the healthcare field since I was 18 years old, and given circumstances of life, I have never been able to stop working to go to school. So this school made that dream possible for me. This school has put me in a place where I can do better for myself, my family. I work in corrections. Corrections is very difficult to fill positions. Not everyone wants to work there. And having this, I'm in my last semester, close to graduating. So I know where I want to go, which is continue to pursue higher opportunities at my job. And I just want to say that I hope that when you guys are reviewing that there is a pathway for us that are so close to hitting our goal, that it's something that's realistic for us. And I can completely understand if moving forward, Nightingale does have to change their curriculum to fit the requests that the Board of Nursing California is placing. But I think that we came into that school double verified, made sure we informed them we're California students. How can we make sure we can apply for this license? I think that, I hope that there's a smooth pathway for us, especially those that have graduated. I can't imagine that fear. And then for us that are just so close. I just passed our exit. Most of us just passed our exit exam. And I mean, we're just all thrilled. We're ready to embark on this new journey. And this has been very difficult for a lot of us. Please take that into consideration and just know that there's some of us out here that this dream would never be possible had it not been for Nightingale set up. And I hope that the board and Nightingale can work together to make sure that it's a school that's still accessible to California students.
Thank you. And Nightingale can remain accessible to California students. What we ask is that they meet our curriculum requirements so that they can meet minimum contact for licensure. If they are not
Yes,
able
and thank
to
you very
do
much.
that, yeah, if they are not able to do that, they would have to put a note on their website letting California residents know that they don't make licensure for California. But I don't think that that's how we're going to end. I truly believe that once the review is completed, if there's any deficiencies, that Nightingale would go and address their curriculum to meet those deficiencies, because a very large population of Nightingale students are California residents. I think the last count we heard at our sunset hearing was 7,000 California residents are enrolled in their nursing program. So my gut is once we complete the review. If there is anything that's missing, Nightingale will do their due diligence to meet the requirements and would update their curriculum to do so. I do want to let you guys know about about a federal code of regulation 668.43, which is institutional and programmatic information. And that is the requirement of the school to vet that their curriculum meets the licensure requirements of the states that they say that they're licensed in. That is not a separate state requirement or a board of nursing requirement. It is a school requirement. And so your school had the onus to ensure that their curriculum met the California requirements for licensure. We are working with your school because we believe that your school did not intentionally try to mislead anybody. And so we are working diligently to get through this review process so that we have a clear path forward again. And I will reiterate, we do want to license Nightingale grads. So we have to meet our legal requirement. And once we are able to establish that we can meet our legal requirement or have a path towards that legal requirement, whether that is taking an additional semester or so, that will be determined. I don't know what that's going to look like, but we do want a path for you guys to be licensed here in California. I also saw several California program directors and other institution affiliated people on this call when you said they wouldn't be able to attend school if it wasn't for Nightingale. I want to let you know that there are many schools within California that offer similar setups that do meet our requirements. They do offer hybrid, they do offer online theory, they do offer flexible clinicals, they do not require you to quit your job in order to go back to school. So I just hope that you continue to look at all schools and not just think that Nightingale is the only path. There are many, many schools that offer similar paths. Thank you.
Thank you very much.
Rebecca Boggs would like to make a comment. 1 second, please. Rebecca on your screen. Oh. Rebecca on your screen behind, if you have open windows, you'll have a small window that will say unmute me. Okay, I'll come back to Rebecca. Daniela Isabella Salcida Canales would like to make a comment. 1 second, please. Daniela, behind if you have windows open up, you'll have a small one that says unmute me. Okay, I'll come back to Daniela. Jane Smith would like to make a comment. 1 second, please. And Jane Smith has left us. Okay, Dallas would like to make a comment. 1 second, please. Okay, Dallas. Let's try Naomi Magana. 1 second.
Hi guys, my name's Naomi, and I just want to say thank you for allowing us to have the time here to express our concerns and answer our questions and even going over your agenda for today. I just have a quick question. I was approved, my application was approved on 6/1. I'm a Nightingale student on June 1st, and I never received my ATT. I did call the board twice, and I was told that my eligibility was going to be sent. to Pearson and it was never sent. And I know now with everything going on, I don't even know if it's going to be sent. So I'm just trying to find out why that happened or what to do.
Loretta, being that this is a specific applicant, do you want to refer her to a specific person or?
Yeah, she can reach out to me again, loretta.melby@dca.ca.gov, and I could ask to bring in our chief of licensing and find out what's going on. But we can't really talk about specific applications or anything.
Okay, thank you.
Thank you for your comment. Anita Vickers would like to make a comment. 1 second, please.
Hi, my name is Anita, and I'd like to start with Reza. I do not envy your position at all. There's a couple quick questions that I had, and also a comment that I wanted to make. As a Nightingale graduate, I have different clinical hours than another Nightingale graduate within the same cohort as myself, because on our different DFC dates, we go to different locations. So, for example, I have been sent to a hospital, right? I have put in hours with pediatric patients through Nightingale, and specifically spent time in med-surg. I was even in the operating room, and I think it was Loretta that mentioned earlier, after 90 days, our chances of passing the NCLEX the first time significantly drop. It's been over 90 days since I've applied, and it's my understanding that the BRN evaluates each application individually. The BRN, I've spoken to 3 different people with the BRN already, and I have not been able to get a definitive answer on how my personal application is deficient or is in question. And I feel as though the Board of Nursing has not properly reviewed my application, and it just feels like, you guys see that I'm from Nightingale, so you put my application on hold. But it's not really on hold because there's no comment. There isn't anything. So I'm wondering, Reza, is there a legal obligation for the board, since it's been past 90 days, for the board to put in some comment for my application in particular? And do I have a right to know how my application is personally deficient?
So the first thing I have to just say and get out of the way, I personally, being the board's legal counsel, as a technicality, can't give you legal advice. So to the extent you're looking for legal advice from a lawyer, that's you have to get that independently. That said, the board doesn't have a timeline or deadline or something to process applications. The 90-day thing, of course, we're aware of that, and we, long before this situation with Nightingale, just as a general matter, the board has always sought to improve its licensing application timelines and all of that. It's very aggressive in trying to, quickly process applications, allow people to test, and have us not be the holdup. I'll admit that's something the board and many of the licensing boards in the Department of Consumer Affairs struggle with, or historically have struggled with, but it's gotten much better with this board. So there's no timeline. You're right. Your application is the board reviews it individually. It's not like you got the Nightingale flag and you're just on hold indefinitely. But the reality is what happens when the board reviews an out-of-state school's curriculum, that review is not necessarily technically dispositive as to whether an applicant from that school gets licensed or not. But that review by the board aids the board's licensing unit when it later looks at an applicant from that school. So if the board reviewed an applicant from a school that has already been reviewed and the board's determined that that school's curriculum is equivalent, then the review of that individual's application is a lot more kind of streamlined and straightforward. That we still look at the individual's application, but it, having the benefit of a determination that the coursework is equivalent naturally just streamlines the review of that. Meanwhile, on the flip side of things, like in your case, the board right now is not certain that Nightingale's curriculum meets the standard. It has been a real difficult thing, I'll acknowledge, to identify for individual applicants what the deficiencies are. And I realize that for you, that leaves you kind of in limbo because maybe you could provide some other evidence of some other way that you met that coursework requirement, or maybe you could go ahead and get started in addressing that deficiency. So we know that that's, a problem, but it's meanwhile, Loretta is having to go through this stuff and identify in the first place what are the deficiencies. And so having to wrap her head around how is Nightingale providing this curriculum? How are they in this, concept-based format that is fine, but is not kind of the more common approach? How do we crosswalk our requirements to, where that content was delivered in Nightingale's concept-based coursework? All of that is I don't envy Loretta, who's having to do that, because it's a challenge, and we're trying to make sure we do it right, which means going back to Nightingale and saying, hey, this didn't look like, we didn't find proof of this, but giving them an opportunity to clarify for us or, show us what we're missing and all that. So in your particular case, in anyone, who's in your shoes, you should get an itemization of what the specific deficiencies are. Unfortunately, for you, there's not a guaranteed time frame for that to happen or a maximum time for that to happen. And right now, if we could have done that, we would have done that to resolve it from our end and to allow you to kind of be on your way, whatever that looks like. But unfortunately, it's still kind of caught up in this process of trying to wrap our heads around what exactly are those deficiencies. So in particular, the last thing I'll say, just real quick, the last thing I'll say is, in your particular case, if you feel strongly that you've got coursework that is sets you apart and that meets, the 500-hour requirement that we consider to apply, and the standards in section 1426 of Title 16 California Code of Regulations, that can be resolved. But for right now, we don't have a list of the exact deficiencies to give you. Otherwise,
all right,
it would behoove both of us. I think she wanted to say something. Maybe it'd be.
Yeah, just real quick. I know is working on reviewing with Nightingale personally. Aren't there other case managers that evaluate the applications individually? Just because, again, looking in the portal, my application is not on hold. It's not anything. It's just in kind of purgatory. So isn't there somebody with the Board of Nursing that can look over my application personally and say what it is, put some sort of comment on where the gray line is?
I'll jump in
And this goes for everybody.
Yeah, I'll jump in and address this and then also do a time check. It is almost 2 o'clock, so we will be adjourning at 2 o'clock. I apologize for those that have not been able to get their public comment heard. One thing before I address your comment that is in the public comments that I want to make explicitly clear, because I don't want anybody, violating a law or anything to that. They're asking if they can do clinical hours in California to count towards completion. Only if you're enrolled in a California approved nursing program. You cannot do clinicals in any capacity in California if you're not enrolled in a California board approved clinical program or nursing program. I apologize that. So I want to make sure that even if you have a facility that says, yes, you can, please don't do that, as you would be in violation of the law. So note that on here, in order to do clinicals in California, you must go to an approved California Board of Registered Nursing program. Now, quickly on this commenter, you did refer to the 90-day review. That is an initial review that was repealed in our regulations. It's regarding 1410.1. That is a error on our website. I've asked for that to be addressed so that it's not misleading to you guys. But that is not a law that is currently in effect anymore. However, the response to wrap up why I am the one that is doing the review. We want this to be a fair review, which means we do not want 7,000 applicants coming from Nightingale getting reviewed by 7,000 different people. Obviously, I don't have that many employees. I only have under about 200 employees, so that would not occur. But we want to make sure that it's consistent, and so I volunteered to do that review process. Additionally, I'm in that review process with Reza and Nightingale. So I'm the one that is involved with Reza to communicate back and forth and receive those documents. So I have access to everything that, hopefully we'll have access to everything that's needed to complete this review. We started this review process early on. We started this review process and asked for information early on. And it took a while to get that information. That was not a delay on the Board of Registered Nursing. We asked for information, it was not received. When we did receive it, we reviewed it, we went back, and Nightingale is being responsive and giving us additional information. But that took a while. That is an abnormal thing. I review many out-of-state nursing programs, and when I request data that has been turned in, this is a different experience. I can't speculate as to why it's a different experience, but that is not typically a roadblock that I run into. When Board of Registered Nursing requests content to do an evaluation, we typically get that. I want to reassure you guys, though, we are getting it now, which is very helpful. I anticipate that the review will be done of the content that I have this week, and then we'll be able to get that and be responsive back to Nightingale and let them know if I still need additional information or whether or not we need a meeting or anything. But I am moving this review through as quickly as possible. I've stated many times today, my goal is licensure. I've also stated many times today that you are the only priority. I have stopped review on every other school pending the outcome of this new information that was received last week from Nightingale. I will then open up review on those other schools immediately following the completion of the Nightingale review. It's beneficial to you guys to have one person evaluating the curriculum and not many, so that you can get a singular statement and we would know that. The reason we have not been able to review a specific applicant's information is because you guys went to Nightingale, and we need to establish that the curriculum or the coursework that you completed at Nightingale meets criteria. Once we're able to do that, we will be able to look at any additional information to see if that can be added to it to qualify you if the Nightingale curriculum doesn't meet. But again, our goal is to see if Nightingale curriculum does meet, because we do want you guys to be licensed here in California.
All right, thank you. I think, Loretta, we have already a time check of 2:04. I think we already passed our time. So we will connect, I think, with the members, the committee members, to set up the next continuation of this meeting. All right. Anything else then before we adjourn?
Reza, again, I just want to thank, first of all, the committee members again for letting this meeting kind of get
for.
I'll say sidetracked, but you know, for something of massive importance. So thank you to the committee members.
You're
Thank
welcome.
you.
Thank you.
know,
We'll hear
huge-
from Loretta then. Thank you.
Thanks to everyone in the public that joined as well and commented. We really appreciate it.
All right.
Thank you.
You have been heard. So unless anyone's got anything else, I think Saji, you can go ahead and adjourn it at 2:05.
Thank
He
you,
may
everyone.
drop off. So yeah, thank you, everybody.